The first bill on the calendar for the day is House File 400. The clerk will report the bill.
House File number 400, number 2 on the calendar for the day, an act relating to health, the fourth engrossment.
I recognize Representative Olson, the member from St. Louis, to explain her bill.
Thank you, Madam Speaker and members. Well, today's a good day that we're here and be able to have House File 400 in front of us. We are in the middle of an opioid addiction crisis. Parents have lost children, teachers have lost students. Our first responders are asked to respond to impossible situations. No other family deserves to go through this, and Minnesotans expect us to take action, enacting comprehensive treatment, prevention, and recovery strategies. Opioid overdoses have skyrocketed in recent years, increasing 66% between 2010 and 2016. And just this year, the CDC announced a drop in life expectancy in the U.S. due in part to the continuing rise in drug overdose deaths. And just today, Minnesota Department of Health released their data on opioids, and I'm sorry to say that things are only getting worse. 422 Minnesotans have lost their lives this year, last year in 2017, to an opioid overdose death. 4 out of every 5 new heroin users started with an opioid prescription. According to MDH, in Minnesota, more than 3.1 million opioid prescriptions were reported as dispensed in 2017. And even with decreasing prescribing, the measures of this crisis continue to worsen. A crisis that was manufactured and took years to create. It will take years of dedicated, ongoing revenue to come to fully address the damage done to our state. The group that has been hardest hit by the opioid epidemic is the Minnesota taxpayer. The cost of responding to this crisis is huge, and it's hard to even calculate. As Minnesotans, we have all paid greatly for this crisis, both in dollars as taxpayers and lives lost. Police departments are forced to fundraise for life-saving naloxone, and they save lives every day in bold and courageous ways. They are asking the same from us today, to no longer push the costs of this crisis onto their police departments and the taxpayers. Counties are drowning in the costs due to out-of-home placement costs created by the opioid crisis. And as one mother who lost her daughter and is here today said, this is a David versus Goliath story. This is the same mother who lost her daughter to an opioid overdose and has driven to the Capitol from western Minnesota almost weekly for 3 years. I can't imagine the drive here gets any easier. Through snowstorms, through memories of her daughter, she keeps pushing. And what an honor it is to be taking this vote today, thinking of Casey Joe and all those who have joined us in the gallery who have lost loved ones. There is one group that has benefited from opioids, but not stepped forward to combat the opioid epidemic. That is the pharmaceutical industry. As was pointed out to me recently, Representative Olson, you keep mentioning revenues when you're talking about the crisis, and this is misleading. You should talk about profits. So, with profits in the hundreds of millions, these groups have still not come to the table. In a sense, the pharmaceutical industry has externalized the cost of opioids while fully owning the successes when financial and otherwise. We all need to be in this together, and with this legislation, we truly do have everyone at the table. So House File 400 requires a license and registration of opioid manufacturers and wholesale distributors of opioids. The bill requires the Board of Pharmacy to assess manufacturers' registration fees in the total of $12 million on a prorated basis on the total number of opioid units. The bill requires the Board of Pharmacy to assess a wholesaler registration fee in the total of $8 million, prorated on the basis the wholesaler's percentage of the total number of opioid units. These revenues, in addition to any funds received by the state from the settlement of legal proceedings against the opioid manufacturers, are deposited into a stewardship account. The bill forms an advisory council of a variety of stakeholders who will make recommendations on grant and funding options for funds annually appropriated to the Department of Human Services Commissioner from the stewardship account. The bill further provides detailed appropriations aimed at education, prevention, and treatment, and providing money to county social services to fight the crisis, as well as specific appropriations for tribes and American Indian organizations. The House File 400 places prescriber guidelines on quantities, certain limitations on dispensing, and requires provider education. This bill specifically deals with acute pain and does not touch the topic of chronic or palliative care. House File 400 seeks to increase access to non-pharmacological pain management options. The bill has language for a non-opioid directive, requires disposal receptacles at sheriff's offices. The bill includes funding for grants to address prevention and treatment, including culturally specific prevention and treatment programs for tribal governments and American Indian organizations. By passing this bill today, we can send a message of hope to the communities and to the families impacted, that we can work together to prevent future tragedies. We're saying today that there is hope in prevention, treatment, and recovery, and that this bill contains strategies for each of these. And with that, I will yield the floor to Representative Baker.
I recognize Representative Baker to the bill.
Thank you, Madam Speaker and members. And again, I want to thank the lead author on this, Representative Olson, for her continued work on this very complicated bill that, for a reason, it has taken me 3-4 years to be a part of getting it to the floor. So Representative Olson, thank you for picking the torch up for me. This is a really important bill for a lot of people sitting up in the audience for a lot of different reasons. And it's important that we go through this bill carefully, members, and we get it right. Because you don't lead a nation on a conversation like this and ask for help from the drug manufacturers and distributors and others and get it right sometimes the first time. So this vote today is important about what we really want to do to help with Minnesotans dealing with addiction, dealing with opioids, and when it was brought to us and why it was brought to us in such a sloppy manner. So I hope that we can have these good conversations today about making sure we assure Minnesotans we are not taking away access by this bill today. I want to make sure we promise them that if their doctor is having concerns, there are other doctors that will help them with their patients to get the right amount of pain medication so we don't hurt our patients. But what we have learned over the last 10, 15 years is that this got totally away from us. We should have done a much better job early on to make sure that when it was going wrong, we should have pulled it back into the garage to fix this thing, because it was about greed at the end. It was about oversupplyment. It was about not paying attention to the warning flags when we saw them in small communities. So there was a lot of players along the way, including the folks like my son, that could have done some things differently, but he didn't know what he was getting into. My beautiful son, Dan, did not want to be an addict. He certainly didn't want to leave his family. And we're going to talk a lot about these amendments today, members. I'm just here to support that. Again, this is Representative Olson's bill, and I'm just really, really proud that Minnesota is going to lead the nation in this cutting-edge bill, and I'm happy to share with other legislators around the country when we get it right and signed by the governor. So with that, I'll yield back to the Speaker. Thank you.
There's an amendment at the desk. The clerk will report the amendment.
Zerwas moves to amend House File Number 400. The fourth engrossment is followed. The amendment is coded A26.
The member from Sherburne, Representative Zerwas, to your amendment.
Thank you, Madam Speaker. Members, the A26 amendment would add to the advisory council a person suffering from severe and chronic pain. We've heard time and time again that the intent of this bill is to not take away opioids from the people that, because of their severe and chronic medical condition, truly need these drugs. Without these drugs, there are prolonged periods of pain and suffering. And so the council in this bill is required to develop measures to assess and protect the ability of these people who legitimately need pain medications. I think it's important that those individuals have a voice on the advisory council and are a part of the discussion. Thank you, members.
There's an amendment to the amendment at the desk. The clerk will report the amendment to the amendment.
Olson moves to amend the Zerwas amendment to House File Number 400, the fourth engrossment as follows. The amendment to the amendment is coded A39.
Representative Olson.
Thank you, Madam Speaker and members. When I saw the Zerwas amendment, it made me think that we've got a 20-member advisory council. It's large, but if we're going to talk about adding valid members to this, I would also like to note, after Tribal Sovereignty Day and learning more about our sovereign nations and our tribes here, that it would be appropriate to have 2 representatives to this membership. So that amendment is changed so that we now would have 2 tribal members on the advisory council. And I would ask for support of this.
Discussion on the amendment to the amendment. Representative Zerwas.
Thank you, Madam Speaker, and thank you, Representative Olson. I would consider this a friendly amendment.
The member from Meeker, Representative Erdahl.
Thank you, Madam Chair. And I would just suggest to Representative Olson, I wish that she had put perhaps 1 member of the Ojibwe and 1 Dakota.
Any further discussion? All those in favor of the Olson amendment to the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment to the amendment is adopted. There's another amendment to the amendment at the desk. The clerk will report the amendment to the
Schumacher
amendment.
moves to amend the Zerwas amendment as amended to House File Number 400, the fourth engrossment as follows, and the amendment to the amendment is coded A41.
The member from Rock, Representative Schumacher.
Thank you, Madam Chair and members. The A41 amendment goes along the same lines that Representative Olson had just presented. I guess we had some of the same idea there, but goes a little bit further. This amendment doubles the number of tribal representatives on the council and increases representation from the people and groups most affected by the opioid crisis. On the council now, there's representation from the Indian tribes, from the medical field, from law enforcement, and others, but we've not ensured representation from communities that are otherwise disproportionately affected groups as well. This council will be making very important decisions about where to spend money to combat opioids in the state. Those decisions should be made by everyone impacted by the crisis, and I would ask members for their support in this amendment so that we don't inadvertently take away voices from those most affected. Thank you.
Representative Olson.
Thank you, Madam Speaker, and Representative Schumacher for bringing forward the amendment to the amendment. I would say that once there is discussion about how big this is. With your amendment to the amendment, we have added quite a few more, and this becomes a large advisory council, and I think it leaves it too vague on who the membership would be. And I think some of the categories of what you're trying to include are also encompassed in this amendment when we're talking about folks from the recovery community, where folks struggling with addiction, folks on the front lines, and I think we have that covered. And so I'd ask for a no vote on the amendment, Schumacher's amendment to the amendment.
Discussion. The member from Sherburne, Representative Zerwas.
Thank you, Madam Speaker. And being that Representative Schumacher has an amendment to amend my underlying amendment, I would ask members for a green vote. Madam Speaker, I'd ask for a roll call on the amendment to the amendment.
Representative Zerwas requests a roll call. Seeing 15 hands, there will be a roll call. Representative Zerwas.
Thank you, Madam Speaker. I think as we talk about this issue and we bring more voices and more experiences together to discuss this, I would urge this body not to limit that and not to cut those voices out. Let's not silence anyone in this discussion. Thank you, Madam Speaker.
Discussion on the amendment to the amendment. Seeing no further discussion on the amendment to the amendment, the clerk will take the roll. The clerk will close the roll. There being 52 ayes and 75 nays, the amendment to the amendment is not adopted. To the Zerwas amended as amended by the Olson amendment. Discussion. Representative Olson.
Thank you, Madam Speaker. I think with the changes made, I feel comfortable that this would be a good amendment to the bill, and I'd ask for a roll call.
Representative Olson requests a roll call. Are there 15 hands? Seeing 15 hands, there will be a roll call. Discussion to the Zerwas amendment as amended. Seeing none, the clerk will take the roll on the amendment. Members, please vote. The clerk will close the roll. Nornis votes aye. There being 125 ayes and 2 nays, the motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Albright moves to amend House File Number 400, the 4th and Grossman as amended. The amendment is coded A27.
The member from Scott, Representative Albright, to your amendment.
Thank you, Madam Speaker. And members, the A27 amendment refers to page 4 under the Addiction Advisory Council, lines 4.19 through 4.23. A little explanation in terms of why the amendment is coming forward. I think oftentimes when we look at the whole landscape of the opioid substance abuse, we leave out a contingency that is using those drugs for very, very important purposes, and those that are suffering from very, very acute conditions, palliative care, suffering through, members, candidly, their last days. And when you think about what a physician or a person suffering from a terminal illness is really looking for, they're looking for the opportunity to have every day be their best day as they finish out life on this earth. And so what it does is it replaces the language, but with one small change is it removes the word unintended. That's really what this amendment is about, members. I know that each one of us have folks in our lives or in our districts who need these. What it does is it asks the advisory council to make sure that those people are protected as we move forward with making sure that we regulate, or control the use for unintended consequences. Thank you, Madam Speaker.
Discussion. The member from Olmsted, Representative Quam.
Thank you, Madam Chair, and thank you, members. To me, this is personally important because I was with my mom the last few days of her life. And this was very helpful to her and those of the family that were with her. And so when we do something, we need to avoid unintended consequences. And I'd ask to support this amendment.
The member from Hennepin, Representative Morrison.
Thank you, Madam Speaker. Members, I appreciate Representative Albright's amendment. I think it's important for the public to understand that this bill is written very carefully to protect prescribers. Clinical judgment is protected. As a physician, I really appreciate that. It does address acute pain prescribing, but it leaves it to the prescriber's clinical judgment. In both an acute pain setting, rarely does a patient need more than 7 days of opioids, but in that rare situation where they do, the bill leaves that open to the prescriber. And for chronic pain sufferers, completely open to the judgment of the prescriber. So I just think it's important that the public knows that those people are protected in this bill. Thank you.
The member from Scott, Representative Albright.
Thank you, Madam Speaker. And to those comments made by Representative Morrison, totally agree with that. That isn't contained in the bill as well. This just makes it more succinct that the Advisory Council will make sure that the people that are most in need of these are taken care of. It does not obstruct the process of prescribing. Thank you, Madam Speaker.
Representative Olson.
Thank you, Madam Speaker. And I think acknowledging what Representative Morrison said, and to Representative Quam as well, that is very true, in that in 4.19 we say the development of measures to assess and protect the ability of cancer patients, cancer survivors, and others battling life-threatening illness who legitimately need prescription pain medications to maintain their quality of life. So we do have language specifically in this bill, and I think we just need to set the record on that is already included. And that said, I think that I would see Representative Albright's as a friendly inclusion and would encourage members to support the Representative Albright amendment.
All those in favor of the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
O'Neill moves to amend House File Number 400, Fourth and Grossman as amended, and the amendment is coded A36.
The member from Wright, Representative O'Neill.
Thank you, Madam Speaker and members. So last week I rose to talk about a motion to bring this bill back to public safety, and there's a very good reason for that, and this amendment gets to that. Under Article 5, if you have your bill in front of you, on page 17, it talks about appropriations going to the BCA. And the chair had said, well, it doesn't need to go to the Public Safety Committee because the money's not coming from the general fund. But what's really important to understand is that it is going to the BCA. And had it come to public safety, we would have had this conversation in public safety. But since it did not, we're going to have that conversation here. And what's really important, what's missing from the bill, is the fact that the BCA will not be reporting back to the legislature what they're finding. And I think that is incredibly important. So my amendment would add that report to the legislature now that we've got these two additional agents out there looking at what's happening with the opioid epidemic, where are the drugs coming from, who is being affected, how many folks are they arresting, how many folks are being sent to treatment, and so on and so on. And so that is what this amendment does, and it fills kind of a hole that I really wish this bill had come to public safety because we would have had a full conversation there. But in light of it not going there, that is my amendment to kind of fill that little hole that is left so that it's a report back to the legislature about what the BCA found. Thank you, members, and I ask for your support.
The member from Ramsey, Representative Mariani.
Madam Chair, members, I think this is a good amendment. We should obviously check in with the author, but I would encourage members to support it.
Representative Olson.
Madam Speaker, and I also would agree that I think this is a good amendment and would encourage folks to support it.
Any further discussion? All those in favor of the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Munson moves to amend House File Number 400, the Fourth and Grossman as amended, and the amendment is coded A19-0227.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker and members. This amendment simply gives an incentive for the opioid manufacturers to continue doing what's right and to continue cutting the opioid prescriptions in Minnesota. The opioid prescriptions in Minnesota are manufactured, about 80% of them, by generic drug manufacturers who are not part of the problem of misinformation and mismarketing that happened 20 years ago. As we saw in New York, after their opioid tax went in play, the prescription drug manufacturers, the generic prescription drug manufacturers pulled out of that market, leaving only the name brand prescription drug manufacturers, and the cost for prescription opioids in that state went up by 1,200%. We need to continue lowering healthcare costs, and this opioid tax is not going to do that. This amendment simply says that the $20 million fee that's assessed to the manufacturer and the wholesaler would go down if the number of prescription drugs in Minnesota for opioids also goes down. And it gives them an incentive to continue lowering the amount of prescription drugs that are prescribed in the state for opioids. It gives them an incentive to do so.
There is an amendment to the amendment. The clerk will report the amendment.
Albright moves to amend the Munson Amendment to House File Number 400, the fourth and Grossman as amended, and the amendment to the amendment is coded A37.
Representative Albright.
Thank you, Madam Speaker. Members, the amendment to the amendment basically just makes a direct correlation on a one-to-one basis. I can certainly agree with the motion on the amendment for Representative Munson, but I think that it should decline on a one-for-one basis. So I would urge favorable treatment of the amendment to the amendment.
Discussion on the amendment to the amendment. Representative Olson.
Madam Speaker and members, I would say to both the amendment and the underlying amendment that prescriptions going down does not actually correlate with better outcomes on fighting this opioid crisis and would not support the amendment to the amendment.
Any further discussion? Representative Munson.
Thank you, Madam Speaker and members. We have a serious opioid crisis here in Minnesota, but it is not just prescription opioid drugs. We have street drugs. We have synthetic fentanyl coming from Mexico. And to tax opioids for the people who need it most in life, like my father who died last year after battling pancreatic cancer for 4 years, to increase the cost of their prescription drugs to combat street drugs in the crisis that we have on our streets is not an appropriate use of this money. We should not be taxing the sick to pay for fighting crime on the streets. We do have an addiction crisis in the state, and I'm glad there's a lot of good programs that are being used with this money that it brings in. But the doctors and the hospitals have recognized that they were overprescribing, and they have made great actions to change the number of opioids that are prescribed in the state, and it has come down significantly. And I think we should continue to incentivize that industry to lower the amount of prescription opioids that come into Minnesota. And so this bill, and I would accept Representative Albright's amendment to my amendment that would make it a 100% reduction based on the percentage change in the opioids that are here in Minnesota. And I would also say that if the percentage of opioids increased, then the fee would increase because it's tracked one for one. So if the doctors and the hospitals are not doing their job in reducing the amount of opioids prescribed, their fee would go up. So I ask for a green vote in this. And members, I'd ask for a roll call.
Representative Munson requests a roll call. Are there 15 hands? I do not see 15 hands. Representative Albright.
Thank you, Madam Speaker. This is about prescribing behavior, members. And as the proper use for these continues to improve, as this bill hopes to achieve, I think it's commensurate with the fees being reduced on the overall usage of these. So I would urge a green vote on the amendment to the amendment. Thank you.
All those in favor of the amendment to the amendment, please say aye. Those opposed, please say no. The motion does not prevail. The amendment to the amendment is not adopted. To the underlying Munson amendment, discussion. Representative Olson.
Thank you, Madam Speaker and members. I would just like to point out that on the Minnesota Department of Health dashboard, so you can go there anytime today on your laptop and you can pull this up. It keeps track of how we're doing as a state around prescribing of opioids and how we're doing as a state around overdoses, both that result in death and that result in hospitalization. And despite prescribing prescriptions going down, we are actually at in the 3 tiers, we are at getting worse, in MDH's own words. So in a crisis that started many years ago and we are continuing to feel the effects now, just because prescribing is going down doesn't mean we still don't have a crisis that was brought forward because of opioid prescribing. So it is also because of that. And I would like to note to Representative Munson's point that also according to MDH that 4 out of 5 heroin users in the state of Minnesota started with an opioid prescription from their doctor. So I would encourage a no vote.
Further discussion to the Munson Amendment. Representative Munson.
Thank you, Madam Speaker. Again, I would reiterate that the manufacturers of opioids that are being sold here in Minnesota are overwhelmingly the generic manufacturers that were not part of this problem 20 years ago. You are increasing the cost of care for those who need these painkillers most. And this bill is a direct tax on our elderly and our sick to pay for other problems we have in the state. So I would urge a green vote.
All those in favor of the Munson Amendment, please say aye. Those opposed, please say no. The motion, division being requested. All those in favor of the Munson Amendment, please stand. Those in favor of the amendment may be seated. Those opposed to the amendment, please stand. In order to be counted, you need to be by your desk. There being 43 ayes and 75 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Munson moves to amend House File Number 400, the fourth engrossment as amended. The amendment is coded A19-0229.
Representative Munson, to your amendment.
Thank you, Madam Speaker and members. This amendment simply puts a 4-year sunset on this bill so that we can reassess the impact this fee has had on opioid availability in this state. As I mentioned earlier, in the state of New York, where the generic manufacturers pulled out distribution from that state, and the cost of prescription opioids in that state went up by 1,200%. It's important to understand what impacts our laws have. We simply would have to go back and reassess this opioid stewardship fee in 4 years. Thank you, Madam Chair.
Discussion to the amendment. Representative Olson.
Thank you, Madam Speaker. And I would request a no vote. This is a pretty hard sunset. This is not a reevaluation. This is letting folks off the hook without making sure we've actually addressed the crisis.
Discussion. Seeing no discussion, all those in favor of the amendment, please say aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Doubt moves to amend House File Number 400, the fourth engrossment, as amended, and the amendment is coded A24.
The member from Isanti, Representative Doubt.
Thank you, Madam Speaker and members. The A24 amendment is an amendment that I think fixes a couple of problems with the bill. Number one, with the funding source that's in the bill, it's going to take a year and a half, I can't remember the language is in the bill, for any of the money to come in and actually be used to help people with opioid addiction. What this amendment does is it replaces the funding source, the fees to the opioid companies, with general fund dollars that would be available immediately. And I think that's really incredibly important. We do have an opioid crisis. I want to thank Representative Dave Baker, who has been just an absolute champion on this issue and trying to make sure that we're helping people who are struggling and fighting an opioid addiction and making sure that we provide the resources necessary to get them the help that they need. The other fatal flaw with the funding source that's in the bill is that if you vote for the bill with the current funding source, you will be voting to increase the cost of health care, period. By putting more cost and drawing more money out of our healthcare system, you're increasing the cost of healthcare for every Minnesotan. We know how it works. Our healthcare institutions and our insurance companies spread that cost over all of their customers, regardless of whether you get prescribed an opioid or not. They spread that cost over all of their customers. So this will literally increase the cost of healthcare for every Minnesotan, and that, I think, is against what all of us set out on the campaign trail that we came here this session to do. I know, because I remember reading a lot of the lit pieces as we went through the campaigns, that a major priority for all of us was to come here this session and reduce the cost of health care. I have a feeling this may not be the first time this session that my friends on the other side of the aisle vote to increase the cost of health care, but I want to call to your attention that when you vote for this bill, you will be voting to increase the cost of health care. Now, that doesn't mean that the things that are paid for within this bill aren't worthy. And I know that many members are going to vote for this bill regardless, because the benefits of what's paid for in this bill are going to outweigh the downside of increasing the cost of health care. And that's a decision that each one of us has to make many times over during a legislative session. But make no bones about it, when you vote for this bill, you will be voting to increase the cost of health care. We also have a $1 billion surplus right now. Now, I wish that last year our governor wouldn't have vetoed the bill that would have provided, I think the number was $16 million of money to help the opioid crisis. We could have, for a year now, already been helping people. But our governor vetoed that bill last year, and we didn't get that help. Now we're going to pass this bill. I know it's going to go to conference, and you're going to work out some differences with the Senate. But unfortunately, because of the funding mechanism in this bill, these dollars won't be available for at least another year. So my amendment gives you a solution to all of that. We'll use general fund dollars, which we have a surplus right now. So we'll start helping people right now. And you won't be voting to increase the cost of health care. So I think this is an important amendment that, frankly, we all should support. Not to mention the fact that we've got additional money coming from the feds. We've already received, I think, $16.6 million from the 21st Century Cures Act. There's another $6 billion worth of money being debated in Washington, D.C. that will get distributed to states. There's going to be plenty of money available. And I know that there are some people that have said that they want to make sure that they hold drug companies accountable or punish drug companies or whatever language you want to use. And I've been very vocal in the past about saying that's not our job. That's something the courts will decide. What we need to do is make sure we get people the help that they need and we get it to them now, which unfortunately this bill doesn't do. Nobody's going to get help from this bill for another year at least when that revenue starts trickling in. So this is a good amendment. It'll get people the help they need now. It won't increase the cost of health care. And it's something I think we all should support. So with that, Madam Speaker, I'd request a roll call.
Representative Doubt requests a roll call. Seeing 15 hands, there will be a roll call. Representative Carlson.
Madam Speaker, this particular amendment would take $40 million from the general fund, and right now we're under Rule 4.03, which says that a bill, once it's reported from committee, cannot be increased in terms of the cost. So this bill or amendment is clearly out of order.
Representative Carlson raises a point of order under Rule 4.03. I find the point of order well taken. Representative Doubt.
I'd appeal the ruling of the Speaker and ask for a roll call.
Representative Doubt appeals the ruling of the Speaker and asks for a roll call. Seeing 15 hands, there will be a roll call. Representative Doubt.
Thank you, Madam Speaker and members. This is an opportunity, just as I said. I know it's tough sometimes to overrule the Speaker, but this is an opportunity to take general fund money, which we have too much of right now. We've got $1 billion surplus, and let's start helping people with the opioid crisis right now. And on top of that, you won't be, if you vote for my amendment, I'm giving you the pressure release valve right here. If you vote for first we have to allow this amendment and then vote for it. But if you do that, when you help these people, you will not be raising the cost of health care for everybody in Minnesota. And when we come forward with solutions like this, the underlying bill, not my amendment, I know we want to help people, but it falls short in those two areas. Sometimes we let the common sense fall to the side in a rush to try to help people. And I hope that we're not punishing drug companies. I hope that this isn't what this bill is about. I hope that this literally is about helping Minnesotans. But what makes me nervous is that the bill doesn't help Minnesotans for over a year. And what does it do in the meantime? It starts punishing drug companies. I could care less about punishing people. What I want to make sure we do is help people. And that's what my amendment does. And I know it's tough to overrule the ruling of the Speaker, but sometimes doing the right thing isn't always the easiest thing. So I would ask you to vote with me and vote to overrule the ruling of the Speaker.
The member from Hennepin, Representative Winkler.
Madam Speaker, every member in this body knows that this amendment is out of order. Under Rule 4.05, if there is no budget resolution in effect, an amendment is out of order if it increases general fund spending, because we need to have budget targets and live within them, and we need to not start spending money until we know what the budget will be for the next biennium. We all know this. We all know that this amendment is out of order and that the Speaker's ruling was correct. This amendment doesn't fix anything. This amendment is a safe vote for some. And this amendment is out of order, and I would ask members to uphold the ruling of the Speaker.
The question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or green vote supports the ruling of the Speaker. A no or red vote goes against the ruling of the Speaker. Representative Doubt.
Thank you, Madam Speaker. I forgot one thing as I was talking about the amendment itself. The other thing that this amendment does, the underlying bill and the funding source in the underlying bill is most certainly going to end up in court. Absolutely, most certainly, it has in every other state. My funding mechanism will not end up in court. And that's another reason to make sure that we're going to help people and get money into people's hands to help with the opioid crisis right now. It's pretty important to do that. So please vote to overrule. And I'm sorry, Madam Speaker, I hate to stand up and ask people to vote against you, but I just want to help people. And I want to do that quickly. And unfortunately, in this situation, it makes me have to ask people to vote against you in order to help people right away. But that's what I want to do. So thank you.
The clerk will take the roll. The clerk will close the roll. There being 75 ayes and 53 nays, it is the judgment of the House that the decision of the Speaker shall stand. There's an amendment at the desk. The clerk will report the amendment.
Teets moves to amend House File Number 400, the fourth engrossment as amended. The amendment is coded A25.
The member from Stearns, Representative Tice.
Thank you, Madam Speaker. Members, this amendment would require the state to review the prescribers' opioid prescribing levels. We would then compare prescribers within the same specialties and require those prescribing a lot of these dangerous medicines to improve their prescribing or risk their licensure. The Department of Human Services is already doing this for prescriptions ordered for enrollees in medical assistance and Minnesota Care. We should make sure that all providers are having their prescribing levels reviewed. In the bill, we already require providers to be trained on proper opioid prescribing best practices. We make important changes to limit the lengths of prescriptions and to limit how long patients have to get a prescription filled. However, we do nothing right now to actually make sure that providers improve their prescribing. Right now, the top 1% of prescribers are prescribing 21.56% of opioids, of the opioid prescription. 1/5 of all the prescriptions out there for opioids. My son John, several years ago, separated his shoulder in a snow skate incident. He was probably 24, going to college, and he was given opioids for the pain. I'm very fortunate, and believe me, I thank my lucky stars often that he didn't take the full prescription because he was going to school, he had finals coming up, and he needed to drive. Several weeks later, when he went back for his first follow-up visit, the doctor walked in and said, "Do you need any more drugs?" That scared the heck out of me. And I think that's something we need to look at. How often are these getting prescribed, and are they following up at an appropriate level? They never asked how he was doing. He was never checked out. My son was mad because it was a waste of his time. And this is one of the reasons why I'm passionate about it. A really good friend and constituent of mine lost his son to an opioid overdose for about the same thing. He had an accident and was prescribed, and he didn't make the battle. What I'm asking is that we just have oversight in seeing that folks are doing the right thing, and this will provide, this amendment will provide that oversight of doctors. It'll allow for our health licensing board to require improvement. Training on best practices is good, but enforcement and oversight of these practices will be better. I would ask for members to support this amendment, and I would request a roll call. Thank you.
Representative Tice requests a roll call. Seeing 15 hands, there will be a roll call. The member from Candy Ojai, Representative Baker.
Thank you, Madam Speaker, and thank you, Representative Tice, for bringing this forward. I wanted to just share with the body, and I'm sure that Representative Olson will make a determination if this is a good thing or not for this, but I want to say that the Department of Health right now, and with a large working group of the prescribing work group, the last couple of years has identified this as being a real issue too. There's some really good providers, doctors, dentists, and others that are really watching what they're prescribing, but not everybody does that. Just in the last few days or coming up in the next few weeks, doctors for the first time in Minnesota, if they are helping Minnesota Care patients and medical assistant patients, are going to get a report card, and they're going to show what they are doing in their discipline group, so family docs can be compared to other family docs. Orthopedic surgeons will do the same with their other colleagues in that field, and so on. And so what's going to happen is this is actually already being done. It's a good process that we haven't even seen what the results are yet. So if these doctors are in that top percentage of that range, they're going to get a letter from the Department of Health. They're going to say, "Hey, Doc Smith, you are in that top range. We just want to give you a heads up that we'd like to have you relook at your prescribing practices. It's then pretty much all it is. It's not a penalty, it's not a fine, it's not anything to do with changing what they're doing, because a lot of these folks are doing it for very good reasons, and if they have some legitimate reasons, they're to share that with the Department of Health, and they continue as onward as they go. So this is being done now. What I like a little better about what the Department of Health is doing is we're not touching the prescription monitoring program, which can get into some very detailed data privacy stuff that I have worked on a lot in the last couple of years. So I support what you want to do with this. I think we're doing it now, and I'll refer to others if they want to support the bill going forward or not, but I think it's a great idea, but I want to make sure the members knew what we are doing already. So thank you, Representative Tice.
The member from Olmsted, Representative Liebling.
Thank you, Madam Speaker and members. So, Representative Tice, I also appreciate what you're trying to do here, and I don't think you're far off the mark, but I don't think the amendment is appropriate at this time. So, Madam Speaker, could I ask Representative Tice to yield?
She will yield. Representative Liebling.
Thank you, Madam Speaker. Representative Tice, did you have a bill to this, and did you bring this up in a prior year, and have you talked to providers and to the Board of Pharmacy about your idea?
Representative Tice.
Thank you, Madam Chair, and Representative Liebling. No, I had not. It was something that I'm very, like I said, very passionate about. It just really scared me when I found out that my son had been asked if he needed a new prescription rather than checking out to see what he was really doing. And I know that's happening in other folks as well. But no, I had not.
Representative Liebling.
Well, thank you. Well, Representative Tice, I'm with you in what you'd like to do, and I think that we all really do recognize the problem, and sometimes kind of over-prescribing or failing to really let me say that again. Providers failing to do their due diligence can sometimes really create a problem as well. So I certainly appreciate where you're going here. But that said, I don't think the amendment is really well drafted, and I think this issue needs a lot more work. First of all, Representative Baker told the body that there is work going on around this very thing, trying to get prescribers to realize that they need to look at their practices and maybe out of step with what's going on, and I think that's a good thing. But the way you've drafted this amendment, it says, annually identify the prescribers who've issued the top 5% of prescriptions for opiate-containing controlled substances for the previous calendar year within each specialty area. And I think that, I'm not sure that just taking a percentage of the top and saying, we're going to now examine your practices is really the most effective way to get at this. And we don't even know if the Board of Pharmacy can really do this with the program that they have, and we don't know if, what it would really take to identify, to review this data that you're asking them, and we don't know also whether this would have a cost. So it may very well be that they can do this without any additional cost, but it may be that it will have a cost, and you're now adding this just as an amendment to Representative Olson's bill when it really hasn't been vetted. So while I appreciate your thought here, I think this needs a lot more work and a lot more consideration, so I would ask members to vote no.
The member from Morrison, Representative Kresha.
Thank you, Madam Speaker and members. And thank you, Representative Tice, for bringing this forward. What we've heard is this is a good amendment. It's almost there. We're going to hear about that in this bill. This bill has to go to conference committee. So I'm just going to be short and sweet. It's a good amendment. This has good potential. It may not be right there at 100%, but I think this bill in its entirety is not right there at 100%, and it's going to conference committee anyway. So why not take the idea, take it into conference committee? If it doesn't survive conference committee, fine, but at least give it a shot, give it a conversation, and give it an opportunity, because what I've heard is there's support for this. And members, this is a good idea. This is a good idea. If you have kids, and I have them as well, that are becoming adults and going to the hospitals and the doctors, this type of oversight is very important, and it could be that last step to help that one conversation to reduce for a kid. So, Representative Tice, good amendment. Members, I urge you to support the amendment. Take it to conference committee and see what happens. The worst that can happen is the conversation doesn't come through and it doesn't come back.
Representative Olson.
Thank you, Madam Speaker and members. I would urge a no vote on the amendment because this bill, although having to go to conference, has already had serious consideration throughout about the revenue it generates and how we spend the revenue. And my concern would be, without understanding the costs of this program, that what I don't know where we would cut from, if it would be the spending that we're going to have in other areas that we've had careful deliberation with. So I can accept the amendment without understanding more about the costs and what it would mean for the other programs we want to make sure are funded as well. So I'd encourage a no vote.
Representative Tice.
Thank you, Madam Chair. Members, I just want to say that I think this is a great way to put a pause button there. If people are prescribing, doctors are prescribing a lot. This is a pause to say, hey, we want you to look at what you're doing and why you're doing it. I truly am grateful that my son not only talks to me, he didn't call me until after he was out of the emergency room, but I think this is how things happen. They don't have the supervision. He was 24. I didn't get to know about it, even though he was still insured under me. So if he would have been under Minnesota Care or Medicaid, it would have been reported. But because we had our own insurance, it would not have been. I think this is a good way to hit the pause button and say, hey, what are we doing here? Can we do better? Thank you.
The clerk will take the roll on the Tice amendment. The clerk will close the roll. There being 49 ayes and 78 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Zerwas moves to amend House File Number 400, the fourth engrossment, as follows, and the amendment is coded A28.
The member from Sherburne, Representative Zerwas, to your amendment.
Thank you, Madam Speaker and members. Members, the A28 amendment focuses again on the Opioid Advisory Council. The council created in this bill is established specifically to confront the overdose epidemic in the state. One aspect of that epidemic is the prevalence and use of illegal opioids by addicts in Minnesota, including heroin and illegally obtained fentanyl. This amendment would address that piece of the epidemic by ensuring that the council considers the impact of those drugs. We need to fully understand the opioid crisis and its impact in order to address it. If we don't understand the prevalence and the significant impact of illegal opioids, we will be doing ourselves a disservice as we try to mitigate the impact of overdose deaths and addiction in the state of Minnesota. The bill already funds an increase to the Bureau of Criminal Apprehension to increase our response to these illegal and dangerous drugs. But there are surely ways to combat the role of these drugs and their impact on tens of thousands of Minnesotans. The council should consider that impact as it does its work. And Representative Olson said earlier, when we talk about the change in prescribing pattern, and that as opioid prescriptions in Minnesota have gone down, we've still seen an increase in our community of the impact of this scourge within our communities, with addiction, with the epidemic of crime that follows that, with the shortage of treatment beds. We know that prevalence is increasing even though prescribing is decreasing. And so an important study as we move forward is the impact and the prevalence of illegal drugs and their use. And so I think it's important, as if we look at Section 4 of the bill, we ask the Advisory Council to study prevention and education. We ask the Advisory Council to study the expansion and enhancement of the continuum of care. We ask the Advisory Council to study the training on the treatment of addiction. We ask the Advisory Council to look at the services to ensure overdose prevention, the development of measures to assess the availability of cancer patients. And so we would just add another request, and it would be for the council to develop measures to identify the availability of illegal opioids and the impact of the illegal opioids on our efforts to curtail this scourge. Members, if we don't address the illegality and the illegal use of opioids, we can make it unbelievably difficult for patients through a physician to be prescribed opioids. If we don't address the illegal abuse of the drugs, we will not address these issues in our community. As this council moves forward, we need to also, as one of 5 other things the council will be addressing, we need to add the impact of illegal opioids in our communities. Thank you, Madam Speaker.
The member from Dakota, Representative Halverson.
Thank you, Madam Speaker, and I rise to oppose this amendment. This really tries to shift the conversation from what we're talking about. And when we're talking about the impact that opioids are having on our communities, we're talking about addiction. We're talking about an illness, we're talking about a disease. And to equate it with crime is a little bit troubling. I've been to many national conferences on addiction. One of the things they always say about Minnesota is, boy, Minnesota's really far ahead. Minnesota's really far ahead in shifting our conversation about substance abuse from crime to addiction, shifting our resources from crime to addiction. Prevention is a huge piece of that puzzle. And we know, and Representative Olson spoke eloquently to it, we know that the root of what we're seeing with regard to illegally obtained opioids are the opioids that have been prescribed to Minnesotans. Opioids that were sitting in somebody's medicine cabinet that somebody's kid or relative got a hold of and started to abuse. Opioids that were prescribed for a chronic condition and the user ended up getting addicted to this drug and ended up having to, seeking out other types of drugs in order to meet that addiction need and not getting the addiction treatment that they needed. And let's be honest about what opioid addiction is like. It is one of the most horrible things that a family is going to go through. We are watching people lose everything. Law enforcement has been in our committees testifying to what they need. And they're not saying that we need more law enforcement. They're saying we need more prevention. We need more treatment. This is what is going to keep our communities safer. The fact that there is law enforcement on the advisory council speaks to the fact that this council is going to have a broad view of the opioid problem that Minnesota is facing. But shifting the conversation, shifting the responsibility to the person who is addicted is really the wrong approach for Minnesota. This is not the way we approach substance abuse in Minnesota. We have to approach substance abuse with science and with care and with knowledge. And Madam Speaker, I would ask members to vote against this amendment.
The member from Lyon, Representative Swedzinski.
Thank you, Madam Speaker. And I just am speaking to the Zerwas amendment and the importance of this. Representative Olson herself spoke to the fact that we're seeing a decrease in prescriptions. We're seeing a decrease in the amount of drugs left in people's medicine cabinets. But yet, we are seeing an increase in this epidemic in the state of Minnesota. And I would have liked to see a combination of the Dowd Amendment and the Zerwas Amendment. I think those two make very good sense to the people and the taxpayers of the state of Minnesota. I think it only makes sense. We do have law enforcement that are currently sitting on that task force. But to say, it was also mentioned that knowledge is power. And I think the more knowledge and the more information that we can bring to this epidemic, I think is to better suit and to better serve our constituents. And I think I would ask you to vote green on this amendment.
Further discussion to the Zerwas Amendment. Representative Olson.
Thank you, Madam Speaker. I think Representative Halverson nailed a number of the points, and I would encourage a no vote. And I would also like to just say to the point, prescriptions going down, but on that Minnesota Department of Health, and we're on the floor for a long time, so I really do encourage members to read that dashboard. There's still 3.1 million prescription opioids that were prescribed last year in the state of Minnesota. I encourage a no vote on the amendment.
Representative Zerwas, to-year amendment.
Well, thank you, Madam Speaker, and members, I guess, to Representative Halverson, the amendment doesn't deal with law enforcement or increasing law enforcement. The amendment deals with providing the Opioid Advisory Council facts. That's what we're trying to do. Gather the factual information. We are being tasked with tackling an opioid public health crisis. And by voting against the amendment, what you're telling us is that you don't want to even consider the data. That illegal use and illegal possession of illegal drugs. We're talking about fentanyl being smuggled in to the country and state from overseas and across our borders. We're talking about heroin that's being used where, yes, a 20 or a 22-year-old or a 24-year-old college student hurts their knee, hurts their shoulder, sprains their ankle at lacrosse practice. And 6 months later, they're addicted to black tar heroin. That's what we're talking about. And the idea that you think the council shouldn't even investigate the role of the illegal drugs and what that plays. Before an opioid prescription, that 22-year-old was not about to be in an alley. It was not about to be shooting up heroin. They just weren't. So why do they find themselves in that position? Members, why? Because they went back to the doctor time and time again. And eventually, the doctor said no. And their addiction remained. And they got it from their friends at first. Then they bought it Then they stole from their family to buy it. Then they helped maybe even some of their other friends find it and use it. And they went into treatment and they went out of treatment. Perhaps they were resuscitated by Narcan once or twice. And then maybe when they got out of treatment, they went back to the same group of friends and ended up in a bathroom or in an alley or in someone's basement or in their boyfriend's bedroom, shooting up and overdosing and dying on heroin. Members, this isn't meant to be political. This isn't meant to be a gotcha. This isn't trying to divert the attention from the crux of the issue. Members, this crisis is huge. It's all-encompassing. It's not just the manufacturer's fault. It's not just the drug's fault. There is such a huge component that comes in, and when it gets its claws into you, into your cousin, into your brother, into your child, you're right, it devastates your family. But the illegal drugs, the fentanyl, the heroin, the drugs that oftentimes are fatal. We can't push forward an opioid advisory council and discount the role of those illegal drugs. Members, just really briefly, the amendment says that a sixth thing will be added, the development of measures to identify the availability of illegal opioids, their rates of use, and the extent to which the use contributes to addiction and overdose. I just think the council should get the data. I just think we should evaluate the role of high-grade fentanyl. We've read in papers where the fentanyl given to teenagers was laced with elephant tranquilizer. And the children died because they didn't know what they were taking. Members, we cannot discount the real, serious, and pervasive impact and role of individuals using and obtaining illegal drugs has on this epidemic. Madam Speaker, I'd ask for a roll call, and I'd urge members to support the motion.
Representative Zerwas requests a roll call. Seeing 15 hands, there will be a roll call. The clerk will take the roll on the amendment. The clerk will close the roll. There being 51 ayes and 77 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Baker moves to amend House File Number 400, the fourth engrossment, as amended. The amendment is coded A29.
Representative Baker, to your amendment.
Thank you, Madam Speaker and members. I wanted to bring to you one of the tweaks to this bill that can make it a little bit better is if we look at that one comment I brought up early on when I first talked about the bill, and that's about access. One of the things we don't know about when you start a new bill like this is, and again, nobody else has written a bill like this anywhere, is that we want to make sure that is it balanced properly with the revenue ideas that we're presenting to everybody today? In this bill, we are raising $20 million, and of that, $12 million, or 60% of that, is coming from the manufacturers of opioids. There's about 75 to 80 companies that sell these drugs to Minnesota. Some of them sell very little amount, and those rates are adjusted downward, and some sell a lot of them. As Representative Olson said earlier, we have over 3.7 million dosages of pills coming into Minnesota, and thankfully that number has been tapering down a little bit each year in the last few years. What this amendment does, members, is it actually brings a little bit more help to that plea to raise $20 million, and we're asking providers in the state of Minnesota, when they sign up for their license each year, to add another $125 to their licensing fee, and of that money will go into the stewardship fee account. That will raise approximately $3 to $4 million. There's about 25,000 providers that have a DEA license. By doing this, it provides a little softer landing to some of the other areas that I wouldn't want to ever contemplate somebody not wanting to do business in Minnesota because they don't know the outcome of this. I think that this bill softens this a little bit. I think this is a good approach to providing better support in a more even field, to provide doctors that have also said openly that they also own a part of this problem that we've had. And I will tell you, I want to give the providers a lot of credit for standing up, certainly before the opioid manufacturers and the distributors. They have reacted much quicker than the last two that I just mentioned. So I have talked to the Minnesota Doctors Associations and others. They are not opposed to this, but members, I think this is a bill that we need to have more conversations about. I think when we get to conference, this is another part of this bill I'd like to address. I think we need to have more hands on deck to, again, make sure that Minnesota is writing the best legislation we can. Madam Speaker, I'm going to withdraw the amendment today. I want to have this conversation at a later point. This one isn't quite ready yet, members, but I want to let you know that I think this is something that we need to talk about as this thing moves forward. So thank you, Madam Speaker.
Representative Baker withdraws the A29 amendment. There's an amendment at the desk. The clerk will report the amendment.
Baker moves to amend House Bill number 400, the fourth engrossment as amended. The amendment is coded A30-1.
Representative Baker.
Madam Speaker and members, this is a big deal for me. This one's not going to get withdrawn. But this is something that I really hope every member in this body will look at this thing seriously, because it's a piece of legislation that I think is a responsible part of this bill that I think is missing from this near perfect HF 400. We have to talk about a sunset clause. I think sunset clauses, when you're writing brand new legislation, ought to have a hard look to see if it's working the way it's meant to be. What this does, members, is it recognizes that there's a very good chance Minnesota and all the other states in the country are going to see some litigation and some money coming our way because of the mistakes and the callous moves on these large pharmaceutical companies that did not take the warnings seriously. They looked the other way, they kept making the money, and they just ignored all the signs that we're seeing hundreds of thousands of people dying from a drug that should never have gotten to this degree. What this bill does, members, is it tells us that, hey, if Minnesota gets at least $250 million in the bank in our stewardship fund to help other Minnesotans with this, that would be equal to, say, 12 years of getting our money out back into Minnesotans' hands, because the addiction and the treatment facilities are in dire need of this. By getting the money in the bank, I also put on 5 years of a sunset at that point to make sure that we recognize that since 1995, when the company was approved the superoxycodone pill called Oxycontin, that is when this whole world changed with opioids becoming such a crisis. Opioids have been around for 100+ years. It is a very important part of medicine. Always has been and always will be. But what happened in 1995 when the FDA approved a pill that was extended release but much more concentrated, it gave the approval of something that we had never seen before, and the company that did this lied to the FDA. And in a court of law, they were found guilty in 2007 and paid this big, massive fine. Pled guilty to some misdemeanors and nobody went to jail. And at that moment in time, there was a moment they could have changed what they were doing, and that particular company did very little to change what they were doing. So here we sit in 2019. So there's likely going to be a whole lot of lawsuits going on, and this is not our work in the body. So this bill, this amendment, members, says if we get the money in the bank, $250 million, then we write out another 5 years because we are already 25 years behind. That was my logic to the extra 5 years. Let's get some money back into Minnesota taxpayers' general fund money that we need now. And I'll stand for questions, members, as well, but I felt this was a very good, logical amendment. And members on the other side of the aisle, I need your help on this one. This is a moment when you have seen Representative Olson and I go arm in arm to every single committee, every single stop. I have been with Representative Olson the whole time. I have defended her. I have helped her. This is the one thing I'm asking for today with this bill is we need to make sure that we have the ability to take a hard look at it. The money's in the bank. Let's go another 5 years. But I don't want to see us in Minnesota double dipping down the road when and if these funds come to us in a large manner, which I think they still will. Thank you, Madam Speaker.
Representative Olson.
Thank you, Madam Speaker. And Representative Baker and I have worked incredibly closely, and he has done a lot of work to get us here. And I know he cares deeply about this, so this will be probably one of the few times we'll do this, but he knows I'm going to do this. And so I'm going to encourage a no vote on this. And so the reason is, I think sunset is one thing, but to talk about it, I would, and we've had this conversation, chatting about the only outcome isn't just ending it with prescriptions or other things. We need to talk about that we've actually stemmed the tide on the crisis and what's happening. Because I've mentioned just today we're learning that things aren't getting better right now. So I would hate to sunset something that has been manufactured over a number of years that we don't know that this crisis ends in 5 years, it ends in 10 years. And to this point, Minnesota taxpayers, it's hard to even estimate the costs of what it has costed us as a state. But, you know, estimates both in lives lost with the 422 folks that we've lost in Minnesota just last year, plus the costs to counties and law enforcement, you know, those totals up to $5 billion annually when we talk about costs to the state of Minnesota. So it's going to take a while for us to get out of this. So with that, I would respectfully ask for a no vote on this, but we'll continue to work with Representative Baker as we move forward.
Discussion. Representative Baker.
And thank you, Madam Speaker and Representative Olson. Yeah, this is where it gets dicey. And we are going to still continue to work on this bill. I know there's no doubt in my mind you and I have the same outcome and the same commitment to getting this thing done right. But members, I have spoken, I think, to almost every member in this body about this bill at some point during the last couple years, if not, but I've spoken to a lot of new freshmen this year. So this is kind of a message to the new freshmen especially. This is a new bill for you. And I know how, as a freshman, you get in line and you try to take the votes you're told to take. But I think a lot of you have also appreciated the work that I've done prior to this year, too. I would have not brought a bill like this to the House floor without having some kind of a sunset clause that I thought was reasonable. I don't think I can think of a better, more reasonable bill than this to make sure that we're doing it right, to make sure that 5+ years after the money's in the bank is about as soft of a land as that I can bring to the House floor. So members, I think this is a super important vote. It's really important to me. Madam Speaker, I'd like to request a roll call on this vote, please.
Representative Baker requests a roll call. Seeing 15 hands, there will be a roll call. Representative Baker.
So members, it's important for us to make sure we're doing it right. Sunset conversations don't mean it has to sunset all the time. I like sunsetting what we're going to be talking about this year. I think the provider tax needs to sunset. But that's a decision we all get to have today. I mean, not today, this session. We're going to have that hard conversation. So what we need to do, though, is take a hard look at this. This is one I'm asking for the Democrats to really see if you believe in what I'm doing and my work on this bill, to know this makes this bill much better as it goes forward and into conference. Thank you, and please vote green.
Any further discussion? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 53 ayes and 74 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
O'Neill moves to amend House File Number 400, the fourth engrossment as amended. The amendment is coded A32.
The member from Wright, Representative O'Neill, to your amendment.
Thank you, Madam Speaker. And Madam Speaker, I do have an amendment to the amendment, the A40, that's kind of a technical fix. We missed a line, and I'd like to include that if we could.
There's an amendment to the amendment. The clerk will report the amendment.
O'Neill moves to amend her amendment to House File Number 400, the fourth engrossment as amended. The amendment to the amendment is coded A40.
Representative O'Neill.
Thank you, Madam Speaker. The A40, like I said, adds an additional line to the underlying amendment. If we could adopt that, then I could speak to the entire amendment. If I could have your support, please. Thank you.
Discussion to the amendment to the amendment. Representative Olson.
Thank you, Madam Speaker. I think it's an author's amendment and fair to proceed with that and support that, and we can discuss the amendment once this is adopted.
All those in favor of the O'Neill amendment to the amendment, please say aye. Those opposed, please say no. The motion prevails. To the underlying amendment as amended. Representative O'Neill.
Thank you, Madam Speaker. Thank you, members. So as I was looking through this bill, I looked through the fiscal note, and I found something rather interesting. If you look at what the fiscal note actually says and what Department of Human Services, DHS, actually requires to administrate this, this new bill, it's quite a bit less than the 5%. In the bill, it's actually written that they would get a 5% administrative fee. They don't actually need all of that. And so I wanted to recapture that additional amount. What the amendment does is it drops it from 5% down to 2.35%, and it reappropriates it to the BCA. And the BCA does some fabulous work, and I've had the opportunity to, on many occasions, to work with Superintendent Evans, who does a fantastic job. He runs a great agency. And if we really want to get to this opioid epidemic, I think it's really important that we fund the BCA as much as possible. Right now, the bill has 2 agents. Additionally, with this movement of money that is not needed by DHS, it would fund them an additional 3 more. So that would be 5 agents that would be really looking at this whole aspect of where are these particular illegal drugs coming from and how can we help even more. So that is essentially what the amendment does, and I ask for a roll call and ask for your support.
Discussion. Oh, Representative O'Neill requests a roll call. Seeing 15 hands, there will be a roll call. Discussion to the amendment. The member from Ramsey, Representative Mariani.
Thank you, Madam Speaker and members. And I'm wondering if Representative O'Neill would yield to a quick question.
She will yield. Representative Mariani.
Thank you, Madam Speaker. Thank you, Representative O'Neill. So first of all, let me just say I agree that Superintendent Evans is a great director for the BCA. We have a quality Bureau of Criminal Apprehension in the state of Minnesota. My quick question is, has Representative Evans requested those 3 additional agents that you identified? Because I haven't heard from him on this issue.
Representative O'Neill.
Thank you, Madam Speaker. So, you know, Representative Mariani, he came before our committee, and I'm sure that he didn't explicitly say that, but remember when the governor's budget came before us, we did talk about the 2, and the work is very vast and very great. So he didn't specifically ask for additional 3, but I think he would be supportive. I could ask him offline if you'd like. Thank you.
Representative Mariani.
Thank you, Madam Speaker, and thank you, Representative O'Neill, and that's fair enough. Members, I would urge you not to do this. I really have no reference on why we would go to another 3, or frankly another 5, or frankly even another 10. It is the bill's design and structure to have 2 agents at the BCA continuing to do the work that it's currently doing it, but doing it with a little bit more capacity. I have to assume, members, that in Health and Human Service, you know, given the framework of the bill and this approach, and the bill and its approach, Representative Halverson spoke to it quite eloquently, is not to criminalize only to come at this from a criminal mentality, but really to look at a comprehensive way in which we can get our hands around the epidemic, the major public health epidemic that we have. It seems to be, members, that the bill's designers, including bipartisan design that goes back from prior to this year, we're comfortable with having it be at 2 resources for 2 agents, and we certainly, particularly given the amendment that Representative O'Neill offered earlier, and thank you for that, Representative O'Neill, we're going to be able to hear back from the BCA relative to their need for that kind of lab work and investigative work relative to opiates at the BCA. And so, members, at this point, I would respectfully encourage you not, and respectfully to Representative O'Neill, encourage you not to do this. Let the current design play itself out, and then let's see what happens in the near future in terms of what kind of capacity, if any additional capacity, the BCA may need.
Representative O'Neill.
Thank you, Madam Speaker and members. And I would just point out that I would have loved to have this bill come to the Public Safety Committee and we could have asked those types of questions, but we didn't have that opportunity. And so here we are left on the floor. So I would have loved to have that conversation in public safety. We only had a very scant conversation about it because we only talked about the governor's bill. And it was just a little sliver of what this is. I would have loved to have the full conversation, but since we didn't have that full conversation and you wouldn't allow us to go to public safety, we are having that conversation here. I wish I could bring Superintendent Evans before us. I cannot, and ask him that question, but I cannot. But I can tell you that the operations of the BCA is vast. It's a large state. They have field operations throughout the state. And 2 agents will just barely cover, and I don't know that it could possibly cover, because what they're going to be doing is looking at drug trafficking in and out of the state and also the flow. So this is a huge component. And Representative Zerwas had already talked about the fact that when you start with prescription and you can't get prescription, the addiction is still there, which means you will find something to satisfy your addiction. If you can't get it through prescription, you will turn to other means. I think it's imperative that we have the BCA be fully funded and fully ready to go to help us with this epidemic. People are dying each and every day. That's why this bill is before us. There are members in this room that have lost loved ones. So I implore you, please support this amendment so that we can take funds that are not needed already, according to the fiscal note, they are not needed by DHS. Certainly, the BCA could put that money to much better use. And I ask you to support my amendment. Thank you.
Further discussion. Representative Olson.
Thank you, Madam Speaker, and thank you, Representative O'Neill, for bringing forward a few amendments today. And I do look forward to more of a discussion. We did accept the amendment today, just to remind members about a study being done around this. So we'll have ample opportunity to learn if this approach is right, if this funding is right. And I would say, without discussion too with the DHS Commissioner or with BCA, that I would ask for members to vote no.
Any further discussion? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. Moran votes aye or nay? Nay. There being 53 ayes and 75 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk, and the clerk will report the amendment.
Albright moves to amend House File Number 400, the fourth engrossment as amended. The amendment is coded A33.
Representative Albright.
Thank you, Madam Speaker. Members, oftentimes when we take a look at broad processes like we're undertaking today, I think that we sometimes lose sight of the broad brush or the holistic approach to this, and I appreciate the amendments that have been put forward on the bill. I also appreciate some of the provisions in the bill. But I think it's also incumbent upon us to have a review of if we're spending money in the right places and if there are other areas of a person's life where more benefit could be derived, whether that be in housing, in their workforce, in their career, in their family life, what have you. And so the amendment, as it was drafted, would direct MMB to evaluate the impact of money that is being spent on opioids. I think that it's making for an opportunity to decide if there are better choices out there as we move from year to year and consider the opportunities of affecting better outcomes for those that are suffering from this very divisive scourge. It puts, in a sense, the effectiveness of our programs exactly where they're most needed. I might note that this idea actually came from the governor's budget as well. Unfortunately, the language isn't quite there as I'd like it to be at this time. And so, Madam Speaker, with that op-ed, I am withdrawing the amendment.
Representative Albright withdraws his amendment. There is an amendment at the desk. The clerk will report the amendment.
Zerwas moves to amend House File Number 400, the fourth engrossment, as amended, and the amendment is coded A34.
Representative Zerwas.
Thank you, Madam Speaker and members. Members, the A34 deals specifically with not including injectable opioids when administered on an inpatient basis. So these are the types of pain medication that are used only in an inpatient hospital setting. It is not the source of the problem we're discussing today. In most instances, these are fully encapsulated dosages that are used as one-time dosing mechanisms for critically ill patients, oftentimes used in settings immediately post significant surgery. So very oftentimes you'll see these in a cardiac intensive care unit where physicians will administer this type of opioid specifically to control a patient's high blood pressure following open heart surgery. All almost all of these types of drugs are currently listed on the FDA's website as being in short or limited supply. It is very difficult to get these medications. They're not manufactured in high volume because of their very limited and specific use. There are so few companies that have this as a product that my fear is that anything that significantly impacts the cost of this medication would likely make it unattainable for patients and providers within the state of Minnesota. Members, I would ask at this time, because of how important this specific drug is for keeping Minnesotans healthy and safe following major interventional surgery, and the fact that there is really no data to suggest that these types of medication are leading to abuse or the opiate crisis, and the current shortage or limited supply of these drugs, that we will be able to exclude these types of medication from this charge. Thank you, Madam Speaker.
Representative Olson.
Thank you, Madam Speaker. And this bill went through HHS policy, HHS finance, commerce, all appropriate places to have had this discussion. Until the amendment was posted on Friday, I had not heard of this. This topic had not come to my attention, and this is a carve out in a bill where we're asking for some, I mean, this is a big part of what we've discussed, so I have not had anyone come to talk to me. So the understanding of this is thank you for your education on this issue, Representative Zerwas. But to carve out a certain opioid product based on the discussion today, I had not heard that. Also, if it is in fact such a limited amount that you have just described, the registration fee and the way it works is based on unit, so it would be a very small cost then to the manufacturer. And I would encourage a no vote.
Discussion. Representative Zerwas.
Well, thank you, Madam Speaker, and to Representative Olson, my apologies. I wasn't made aware of this concern until the end of last week as well, when individuals approached me with their concerns about the limited supply. My hope is that this issue will be something that can be revisited in conference, and what I do not want is to have the House to take a negative position on this issue at this point. With that, Madam Speaker, I'll withdraw the amendment.
Representative Zerwas withdraws the A34 amendment. There's an amendment at the desk. The clerk will report the amendment.
Bennett moves to amend House File Number 400, the fourth engrossment as amended. The amendment is coded A35-1.
The member from Freeborn, Representative Bennett.
Thank you, Madam Speaker. And Madam Speaker, before I start in on my amendment, I'd like to request a roll call.
Representative Bennett requests a roll call. Seeing 15 hands, there will be a roll call.
Thank you, Madam Speaker. Members, I would just like to touch a little bit on something that's pretty near and dear to my heart, and that is that I believe we need to be working toward a smarter and a leaner government. And my amendment, I believe, would help to do that. And what this amendment does is puts a 10-year sunset on both the funding source, the fees, as well as the advisory council. And I think this is important for a number of reasons, but number one, we need to start measuring the effectiveness of what we're doing, especially when we're spending a lot of money, which is what this is, and whether the money comes from the fees or whether it comes from, for example, Representative Baker's idea to let the fees sunset and let it come from lawsuit money. I think either way, we need to make sure that what we're doing is effective. I believe giving 10 years for this program and this initiative to get up and rolling and moving would give us enough time to determine if what we're doing is really working. And that's important because as government, we tend to just pile initiative upon initiative on, and we never go back, or rarely go back, and see if it's working. And we end up with this huge bureaucracy of initiatives. So why the funds? First of all, when we have a lot of funds involved like this, it gets, excuse me, excuse me, I'm sorry, I can't concentrate. So when we have a lot of funds like this, we tend to just let them go on and spend, and again, not determine the effectiveness. As for the council, I think that also needs to be evaluated to make sure that that's working as well. It doesn't hurt to stop and take a look, and I think a 10-year sunset would do that. It would make, have the legislature say, all right, we need to take a look. Is this working? If it is, let's keep it going. If it's not, then let's find something different than we can do. And finally, I'd like to say that I've talked to my constituents a lot about this back home, just to get their ideas on it. And what they say, many of them, is we need to do something. And I agree with that. This is a huge problem. And we've got a lot of people sitting up there that know it's a huge problem too. So we've got many good initiatives here, but they too are concerned that we'll just go on and on, even if it's not working. So their idea was to put a sunset, and I agree with that. I think we need to stop and take a look in 10 years and see what happens with this. And so with that, members, I will stop talking and would ask for your green vote.
Discussion. Representative Olson.
Thank you, Madam Speaker, and I would ask a no vote on this amendment. As soft as the language was that Representative Bennett just talked about, the exact language of the amendment is a hard stop on the council and on the opioid registration fee on July 1st, 2030. No evaluation if things have gotten better, no data, no. So this is a hard stop. It isn't a look and see if this is working, it's a hard stop. And with that, too, that we did set up, and to Representative Bennett, in the bill, we did set up a series of reporting back to the Advisory Council to see if the programs that we're funding are effective, to see if we're stemming the tide. So we have put in fact, multiple reports, and we just amended in one more today to make sure that what we're doing is we're not just spending money and hoping that things are getting better. We're going to appropriate, we're going to evaluate, and that is exactly why we have a council, is to be able to look at this. So a hard stop on a hard date when we have no idea if we're actually, what kind of improvements we're going to make, I'm going to respectfully ask for a no vote on this.
Any further discussion? Representative Bennett.
Madam Speaker, thank you. And Representative Olson, thank you for those comments. And I want to thank you and Representative Baker for your hard work on this. I think there's so many good initiatives to it. I have a lot of heartburn myself on where the funding is coming from. As Representative Dowett said, we're raising the costs of health care with this. And we're putting those costs upon the people who are hurting the most. And those are the people who need these drugs, our seniors and other people who are in extreme pain. And I just cannot see raising the amount of costs of health care when it's already so high. So I think wonderful that we have studies in this bill, but we can study upon study, and it doesn't mean we're going to circle back and decide, is this effective or is it not? And I'm going to go back to saying I think government needs to be working more in a smart way and an effective way and in a lean way. And putting sunsets on things is not a bad thing. It just means we're going to take a look. So we'll look at those different studies and decide, is this working or is it not? As a teacher, I did that all the time in my classroom. So the teachers in this chamber and those who might be listening, they understand this. We don't just start initiatives in our classroom and then go on and just think, well, maybe it's working or maybe it's not. Let's circle back in 10 years. Let's make sure it's working, and this would allow for that. Thank you, Madam Speaker.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 51 ayes and 77 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Olson moves to amend House File Number 400, the fourth engrossment as amended. The amendment is coded A42.
Representative Olson.
Thank you, Madam Speaker. And this amendment is actually a technical amendment that was brought to the attention due to a staff error, and it takes line 17, line 16, and changes an appropriation by decreasing the amount and making it to stay in within the revenue generated in the bill. And again, this was a technical amendment due to a staff error, and I ask support of it.
There is an amendment to the amendment. The clerk will report the amendment.
Doubt moves to amend the O'Neill amendment to House File Number 400, the fourth engrossment as amended. The amendment to the amendment is coded A43.
Hold on just one moment while I confer with the clerk. Representative Doubt, to your amendment to the Olson amendment.
Thank you, Madam Speaker. I'd offer the A43 amendment, which basically takes the money. There's a reduction in the Olson amendment, which I do not have right in front of me. There's a reduction in the appropriation to DHS in the bill. My amendment takes that reduction amount and gives it to BCA to use for drug-related law enforcement purposes.
Representative Winkler.
Madam Speaker, I rise to a point of order under Rule 3.33E. This amendment to the amendment is not technical in nature, appropriates money to a different fund to a different purpose. It's not simply a numerical correction. It is a substantive amendment, and I believe it is out of order.
I find the point of order well taken. To the underlying amendment, the A42 Olson amendment.
Point of order, Madam Speaker.
State your point of order.
I would rise to a point of order that the amendment being offered did not meet the 24-hour rule as outlined in Rule 3.33, and that the amendment is not technical.
Representative Winkler.
Madam Speaker, advice.
State your advice.
Madam Speaker, just so members understand, this is a decrease in the appropriation of $519,000. Under the way this bill is structured, the $20 million fund, whatever is the balance left over goes to DHS. So even if we did not adopt this amendment, this bill would still work. This is a correction to make sure on a technical basis that we are appropriating the specific amount of what is remaining. So members, it is not absolutely essential that this happen. It's just better practice. It's a technical correction. And Madam Speaker, I would ask you to find the doubt point of order not well taken.
Representative Doubt.
Thank you, Madam Speaker. I'll offer some advice that might sway a little bit from advice, but I think what's happening here is this moved a little bit quickly. I would like to know why people think that this is a technical amendment. And let's not blame staff here. Let's just talk about when did these numbers show up in fiscal notes and when should we have known about this? If it's something that we didn't catch because a bill moved too quickly through the committee process, then that's not a technical correction. This is something that, and I appreciate that you're reducing an appropriation. Believe me, I voted for every one of those that I could over the years, and I'll probably vote for this one too. But I don't want to pervert our rules in allowing something to slide in under a technical amendment that is not technical in nature. So this one may be, I'm not saying that it's not, but I'd like somebody to explain why it is technical. And what I'm looking for in a definition of why this is technical is when did the lower number show up on a fiscal note? And I'd like to see a copy of that fiscal note. On Friday, I know there was a new fiscal note. Was the lower number in the old fiscal note? And we just didn't catch this as it went through committee. I just want an explanation. And I apologize about the gymnastics of trying to find a way to stand at the microphone, but this is the only way I could find a way to stand at the microphone to ask you, why do you think this is technical? Because I'm certain that you don't want to set the threshold and the bar in an inappropriate place on what a technical amendment is, because it could come back to haunt you as well. And that, it wasn't really advice, Madam Speaker, but maybe under their advice, they can respond to the question that I'm trying to ask.
Representative Winkler.
Madam Speaker, advice. The fiscal note did have there was a preliminary fiscal note which had the higher number. The final fiscal note came in later. There was an amendment to adjust the bill to fit the fiscal note, and one of the adjustments in the amendment in Ways and Means to fix the appropriation to match the fiscal note was not included in the amendment. And as I said earlier, this is technical in nature because the appropriation is limited at $20 million anyway, so the balance wouldn't be possible to appropriate the higher number. So even if we didn't adopt this amendment, we'd still be with the lower number. But by doing it this way, we are doing better, cleaner work. And so, Madam Speaker, I would ask you to find, once again, the doubt point of order not well taken.
I've reviewed the...
Madam Speaker, I'll withdraw my point of order.
Representative Doubt withdraws his point of order. To the A42 technical amendment, all those in favor of the amendment, please say aye. Aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 400, as amended.
Third reading as amended. Discussion to the bill as amended. The member from Cass, Representative Poston.
Thank you, Madam Speaker. I rise in support of House File 400, and I'd like to just tell you a brief story that I think puts the fee structure into perspective. When I'm not here working with my legislative hat on, I'm in the restaurant business. And we operate 5 restaurants and a catering business, and we sell alcohol in all of our entities. We do about $1.5 million worth of alcohol sales a year, and we pay a licensing fee to do that of $35,000. So I'll just say that once again. We do $1.5 million worth of business in liquor sales, and we pay $35,000 for our liquor license. And we know when we pay that fee goes to support law enforcement, alcohol education, and addiction programs. I think it's kind of crazy that an opioid company can come into our state and sell as much as $60 million worth of opioids and have a licensing fee of $235. We need this bucket of money to do the same thing with this bucket of money that we do with the money for liquor license. We need to support law enforcement, we need to support opioid education, and we need to support opioid addiction programs. You know, we need this funding. Representative Olson and Representative Baker have done a great job. Please support their bill.
Representative Cagle.
Thank you, Mr. Speaker. And members, about 3 years ago, right around this time, my family was fighting to save my youngest brother's life. He was using heroin. I saw my brother passed out while he was smoking a cigarette, while he was eating, and he was also driving around while he was high. He drove off the road a few times, and I thank God that nobody else was injured. He was facing some serious consequences due to his addiction. And my brother was first introduced to opioids after his appendectomy at 15 years old. And I have to admit that I feel a little bit responsible for his addiction. I've dealt with chronic back pain my entire life and had my first back surgery at age 13. He saw me using prescription pain medications. Not knowing what we know now, I trusted that what we were being told about these so-called harmless prescriptions. I worry I had too lax of an attitude towards these dangerous drugs. After my last surgery, my brother was living with me and my husband. I had to hide my pain medications from him because he was sneaking up to my room and prying open my prescription lockbox. On March 29th, my youngest brother will be receiving his chip for celebrating 3 years of sobriety. We are so lucky that he is still alive. My brother had a support system around him. My brother had a mom with a good credit score who was able to use that to pay for, and is still using that to pay for his treatment, recovery, and sober living. My brother had a dad that made sure that he always had a way to get to and from his appointments, even though he was nearly 2,000 miles away. My brother has 2 siblings, a grandmother, aunts and uncles, cousins and in-laws that would do anything to help him. What I worry about is those people who don't have that support system like my brother. I worry about the people who don't have the money or the credit to pay for treatment and recovery. I want to make sure that every Minnesotan has the chance my brother had to fight this disease and has the support to fight this lifelong battle. So please vote yes, members. Thank you.
Representative Quam.
Thank you, Mr. Speaker and members. And reviewing some of the amendments, I would hope in conference committee that you could look at in the composition of the council, trying to allow for some of the other members so that someone could fit a couple different of the things that were brought up today. I know you don't want the council to bloom into something bigger, but it'd be nice if there was a way to combine some of that. Earlier was brought up some issues about the way this is funded, and I do have concerns about the Commerce Clause and opening for lawsuits that would complicate this. Frankly, one of the things that bothers me a lot is wanting to not have any sunset clause. We had 4-year, 5-year, 10-year after we get a huge windfall from a lawsuit. And my first bill, I myself put in a sunset after 3 biennial budgets. Because frankly, we as a legislature should be looking at what is effective, what is not. And I was surprised on the 10-year. Do we have no confidence in what you're proposing in the bill could be effective across 10 years? But it all comes down to the fact that if we want to be a lazy legislature, we put everything on autopilot. We have nothing expire. We never force ourselves to actually go back, review our work, because no bill is perfect, even ones I bring up. But no bill is perfect. So to ensure that as things changes over the years, that if we have a mechanism built in, that we are forced to actually look and see what's working and not, see if things have changed. Because frankly, I'm sure healthcare, I'm sure drugs, the way they're produced, imported, distributed, etc. will change. And it's only prudent that we realize life is not static, and that we hopefully, when it comes back from conference committee, have some sort of a review process put into this, because this is too important of a process to do it once, forget about it, and leave it on autopilot. Thank you.
Representative Hertaus.
Well, thank you, Mr. Speaker, and thank you for the conversation that we've had. This opioid addiction issue is a serious problem. We all admit that. I know that. I know people who have been addicted. Many of us have dealt with addiction in our own immediate families, and it's something that touches our heart near and dear. I've followed this issue for a number of years. I haven't been directly involved in HHS committees, but I'm particularly troubled with the manner and the mechanism in which this bill is being funded. I have 4 decades of experience in being licensed in 4 different occupations, and I can assure you that the licensing is not with the idea of 5 years or 10 years, that it's going to be a temporary thing. This will be an onerous thing upon providers that will continue to cost fees and money. It will also require additional education and continuing education and then mandatory courses, and this is just onerous on the industry. This is an attack on providers. And while I have empathy and sympathy for everybody who's lost loved ones over this issue, we've lost a lot of people in other areas of addiction as well. and for the reasons that this bill is being funded, not for the purpose of which it's being funded, I have to ask you oppose the bill. If this had been taken from the general fund, I would be 100% behind it. But creating a whole new bureaucracy and using a revenue stream such as this, it just seems that if everything is a priority, nothing is a priority, and we're sent here by our constituents to make difficult choices based on general fund spending. And if Speaker Dowd's amendment could have been adopted, and I realize it was out of order, but that's the manner in which this bill should be going forward and how we should be funding it from the general fund. So for that, members, thank you for the discussion, but I cannot support the bill as written.
Representative Halverson.
Thank you, Mr. Speaker. And I rise in firm support of this bill. This is a bill that's time has come. Thanks to Representative Baker for his years of work on this issue at the state capitol, working with various stakeholders. And thank you, too, to the families who have been here for hearing after hearing. And I know that they're here in the gallery today. And there's been many times during the discussion that I've looked up because they really give a lot of perspective to what's at stake here. The families of Minnesota are at stake. And one of the things that strikes me so strongly when these families show up who have lost children, and I'm raising my 11-year-old, and it's clear to me that they're here in their loss to save our kids. They're here to make sure that my kid and your grandkids are safe and have the resources they need to prevent ever being addicted to opioids, to provide treatment to people who are suffering addiction. They're speaking for our kids out of the loss of their own. And that sits in my heart, and I think about these families all the time. And I also think about responsibility. And we talk a lot about responsibility here at the Capitol. And I'm troubled. And I'm troubled when I hear that the people who made these drugs, that the people who chose to falsify studies, to falsify research and tell doctors to expand their prescribing of opioids. As Representative Baker said, opioids have been around and have been part of treatment protocols for decades. But there was a concerted effort on the part of pharmaceutical manufacturers to make sure that more opioids were going out the door, to the tune of billions of dollars. You look in the early 1990s, before this really got off the ground, and pharmaceutical companies began to specifically market new uses for opioids. For chronic pain, they claimed that people with chronic pain couldn't get addicted to opioids. Do we know that that's not true today? You bet we know it. Are people still suffering addiction? Yes. And then in the 2000s and the late 90s, as Representative Baker said so eloquently, they found a way to deliver that drug more effectively. And we know, because a lot of these folks are getting sued through discovery, not only did they work to addict people, but they tried to blame the addict. How can they figure out how to blame the addict for their addiction? How can we figure out how to make this about crime and about people's bad behavior and not about the fact that they're addicted to a drug that was prescribed to them by their doctors? And so opioids became less available, treatment protocols, prescribing protocols began to change, and the black market started to open up. And we see families that are being hit with deaths from heroin, families in our suburban and rural communities. You know how we talk about the Midwest, salt of the earth. And these families are being hit with an addiction to a drug that we could never imagine. And then they started turning out synthetics like fentanyl. Now, fentanyl You didn't even ever used to hear about fentanyl as a drug that anybody took outside the hospital. That was given to you in the hospital, but that moved on too. Synthetic opioids have moved on. And people are dying. I just added it up again, and I had to check my math with Representative Olson because I can't believe this number. In 2017, 442 people in Minnesota died of opioid addiction. They died of overdose deaths. What a horrible, horrible way for families to lose somebody. And we're wringing our hands and wondering what to do, and the science tells us exactly what to do. The science tells us, do what Representative Olson put in her bill. Do what Representative Baker put in this bill. Have a multi-pronged approach, which we have done. We have changed our laws around Narcan. We had to come into this room and vote to make sure that Narcan was available to all EMTs in public spaces because it saves lives. But what's the underlying problem there? It's the addiction. And it's the fact that when you're addicted to opioids, your risk of death is much greater than with other drug addictions. The stakes are far too high for us not to pay attention. And some people talked about that this is going to cost more because we're going to charge a fee to these manufacturers. You want to talk about cost? Talk about the $16 million that one health plan in Minnesota had to spend on opioid addiction. One. Talk about the $400,000 additional spending that we had to spend through medical examiners' offices in Minnesota because of deaths from opioid. That's the way our general fund money is being spent. And the thought of putting more of that responsibility on the taxpayers and not asking the folks who marketed these drugs to doctors, not asking the folks who made these drugs and made billions, billions and billions and billions, whether they were part of the conspiracy to try to grow this market or whether they just raked in the money themselves, this is part of the problem. So for us to ask for them to pay just a little bit so that our healthcare system can cope with this crisis, so that our state government can cope with this crisis, so that our county can cope with this crisis, makes perfect sense. Look at the way we've done it before. The tobacco companies have had to pay, and you know, we actually sunset part of what we collected from the tobacco companies because Clearway, Minnesota is going away, and we know that tobacco use is on the rise. And so making sure that Minnesota is in a good place before this, something like this sunset makes a ton of sense based on our state's experience. And I think one of our committee hearings, we heard a law enforcement representative who was there, and the pain on their face is just unbelievable. You know, these are the folks that have to go to somebody's house and tell them that their loved one is gone. And he spoke so eloquently, and one of the things he said, which really struck me, he said, remember that when people died taking Tylenol? And I had to go and Google it, because I remember that distinctly, and it felt like it was widespread and all over the country. I was a kid at the time. It was 7 people that died in Chicago from those Tylenol deaths. And what did the drug manufacturer do when 7 people died? Every pill was pulled from the shelves. Every pill was pulled from the shelves, and nobody said, boy, it's going to increase healthcare costs because we're not going to be selling this. Every pill was pulled from the shelves, and nobody said, boy, I'm really worried about the stockholders of this company. Every pill was pulled from the shelf because people were dying, and action had to be taken. Now, we're not asking for people not to have access to opioids. We're not asking for people not to have access to medicines that they need and that their doctor prescribes to them. We are asking for these companies that helped manufacture this crisis in our state and around the country and around the world to be part of the solution and join us and help our counties and help our state and help our citizens to get ahead of this crisis and make Minnesotans safe again. So Representative Olson, great job. I'm glad we're having this conversation, and can't wait to vote yes for your bill.
Representative Howard.
Thank you, Mr. Speaker. I rise in support of House File 400. I want to thank the author, Representative Olson, and Representative Baker, and to the Minnesotans here today. And as I've been listening to this debate, it seems there is a lot of agreement on this House floor that we absolutely have an opioid epidemic in Minnesota. And really where the choice before us is, are we going to listen to the argument from Big Pharma, or are we going to stand up for Minnesotans? That's the choice before us here. And Representative Doubt, in his amendment, made the comment that he doesn't think it's not our job to hold big pharmaceutical companies accountable. I'd say, whose job is it? It is our job to stand up for Minnesotans. And I don't think Minnesotans buy the argument from Big Pharma that if we ask this sliver of their profits to participate in this solution, that is going to raise healthcare costs. And I'll tell you why Minnesotans are not going to take kindly to that argument is our drug companies are already gouging Minnesotans. Year over year over year. Just at the beginning of this year, we saw 1,000 drug prices go up by 2 or 3 times the inflation. OxyContin went up by 9.5% this year, 4 times inflation. It's been referenced that this is onerous on the drug companies. Well, I'll tell you what's onerous. What happened with the drug Actar, a drug that's made by one of the big opioid manufacturers. That drug treats spasms and MS. That price went from $400 a dose to $36,000 a dose. So if you want to talk about raising the cost of healthcare, and just look at what's happening with insulin, where the price has tripled in the last 10 years and Minnesotans are dying. So I don't buy the argument that Big Pharma, we should be listening to Big Pharma's advice about what's going to raise the cost of healthcare because they are doing it, and we need to stand up for Minnesotans. And of course, there's finger pointing. Big Pharma will point to other areas of the healthcare system and say, we're not responsible. And there are certainly many actors in a complicated healthcare system, that's true. But when you look at the dollars and cents, Representative Olson referenced this, we're talking about companies with billions and billions of dollars of revenue and hundreds of million dollars of profits, while our state and country have slipped into a public health crisis. And I just want us to just take a second to boil down this argument that we're hearing from Big Pharma. They created these powerful and dangerous drugs and were untruthful with the public about their impact. They raised the prices of these drugs and made hundreds and hundreds of millions of dollars. Meanwhile, we slipped into one of the worst public health crises in our nation's history, I'd argue. And then when we're asking them to contribute just a sliver of their profits, the argument is, well, we'll have to raise the prices on drugs, and we can't do that because, boy, right now, Minnesotans are forced to decide whether they're going to pay for their groceries or pay for their prescription drugs, so you better not raise the cost of prescription drugs. That argument would be laughable if it wasn't so offensive. The truth is, Big Pharma has made a killing off the pain and misfortune of Minnesotans. And we absolutely need to hold them accountable. For our communities that have been harmed, for Minnesotans that have lost loved ones, it is the right thing to do. Thank you, Mr. Chair.
Representative Zerwas.
Thank you, Mr. Speaker and members. I respect and commend the work that for years Representative Baker has put in to this issue and put in to crafting this legislation along with Representative Olson as the chief author this year. I have no doubt that their intention and goal is to provide a safer and better Minnesota. I believe in their heart, they believe that this is the best way to accomplish that. And if you look, members, at where the money is being proposed to be spent from this bill, I think in many ways this bill is on the right track. I think the areas that they've identified within social services, within our counties that have been impacted, within our public health response, I think those areas deserve this funding and that investment. But members, my concern is with the mechanism being utilized to raise the funds in order to accomplish those goals. This bill sets up a $20 million target and works backwards from there, in that $20 million will be raised annually no matter what happens. And the math goes backwards. And so, members, the more prescription start to fall in the state of Minnesota, the higher the cost per pill starts to rise. And so this funding mechanism acts as a disincentive to drug manufacturers and drug distributors because their cost per unit will skyrocket as the volume begins to drop. And so if the goal is to lower the amount of drugs being prescribed, being manufactured, and then distributed into the state of Minnesota, this funding mechanism will not attain that goal. The other challenge with the funding mechanism is the companies, whether you're manufacturing or distributing in the state of Minnesota, you don't know what your fee is until till several months after the end of the year in which you will be assessed. The drug market shares and how big a company is and how big their competitors are is all secret, protected, proprietary information. And so a distributor does not know what share of the market they are. In fact, they don't get to decide how much of a drug is shipped to Minnesota or distributed in Minnesota. That is handled federally. And so they're told, they're licensed, and they're told, ship this many units to Minnesota, ship this many units to Iowa, ship this many units to Wisconsin, and all of their competitors are told that. They don't know what their competitors are being told to ship, and they don't know where they rank in what they are shipping. And so what we're proposing to do is to look back and take a proportion of what part of the market they were and assess a fee on them based on that. A proportion of the market that they didn't decide and they didn't know. Their only option, if they're a small portion of the market, will be to discontinue doing business in the state of Minnesota. That may very well happen for some of the companies. And that could be what some supporting this bill are hoping for. But the challenge is, members, is that the product being distributed and being manufactured is still being prescribed and used by patients here in Minnesota. And it's needed for some patients here in Minnesota. Members, the challenge with this bill, as it's laid out, is that the folks being assessed the fee have no insight or impact on the fee that they will be assessed by the Board of Pharmacy. And then, oddly, in the bill, if they disagree with the assessment from the Board of Pharmacy, well, don't worry, members. You probably saw that portion of the bill. Yes, you get to appeal your assessment. But members, your appeal goes directly back to the Board of Pharmacy that just levied the fee. And so you end up appealing to the exact same board that levied the fee. I said before, and I'll reiterate it, that I don't have concerns, and I support where the funding is going. And this debate isn't, I don't think, is really about that portion of it. In my previous career, I saw firsthand the impact of drug use and the opioid and heroin epidemic here in Minnesota. I can't tell you the number of overdose deaths that I was dispatched to, the families that I interacted with, the investigations that I participated in. The crisis is real. It's heartbreaking. It's devastating. But what I would suggest is this funding source from a non-transparent process that has no visibility, this funding source with not everyone having a seat at the table and a role to play for accountability, this funding source is the source of my concern. And so, members, my hope is that as this bill goes through the process and is worked on in conference committee, my hope is, and I kind of suspect what will happen, is that we will come back with a bipartisan bill, with a bill that addresses many of these concerns, a bill much more similar to what's advancing in the other chamber, and a bill that will likely put north of 100 to 115 green votes on the board. Members, at this point, I'll vote red with my hopes that later this spring we'll have a bill that we can all agree on. Thank you, Mr. Speaker.
Representative Sundin.
Thank you, Mr. Speaker. I'm just going to challenge everybody to a little bit of a memory test here. About 10 months ago, I rose on the floor and chimed off about 15 names of Minnesotans that were not in the room because they had succumbed to opioid-related death. Anybody remember those 15 names? Me either. Can't remember one of them. It's shame on us. This is about death. This is about death of our youth, our families, our friends. I thank Representative Halverson for reminding us of that in her comments. And we can't desensitize ourselves just by rattling off numbers and figures and proposals from pharmaceutical companies. We're not going to escape that. I've been in jobs where I had to desensitize myself from what I was doing, because it could be overwhelming. I was actually a grave digger. That was my first job. I was a grave digger. And people thought it was somewhat interesting, but you knew a lot of those people in these small communities, and a couple of cemeteries that I served. And doggone it, you had to remove yourself from what was going on, because memories would take you back on that person, and you didn't want to go there. You had a job to do. So we tried not to reflect on the people that you were putting in the ground. And sometimes we'd lower them down with ropes if there's nobody else to help. We'd actually use ropes and some mechanisms to lower these people into the ground. But enough of my first job. I'm going to tell you a story about a young man that was jogging up Highway 61 years ago, and in the evening, and he was hit by a truck, and his body was demolished. But he did survive. He did survive. It was a life-changing event for that young man, and after several months of therapy and lots of opioids, he was physically better, but after several months of opioids and extended use of them, it challenged his sanity, and he committed suicide. He had no longer control of his mind and committed suicide. And I'm not going to blame the pharmaceuticals that it was their fault this fellow committed suicide. It's yet to be determined. I don't know if the doctors misprescribed. I'm not going to blame the doctors. I'm just looking forward to voting for a bill that is going to make things better for other people, so they don't succumb to some of these challenges. So, anyway, after the suicide, he was buried in the cemetery, one of those quaint little cemeteries. It was a cold day in January. So most of the family stayed back in the community center, and just a few people went up. And this is the last burial that I took place in, or assisted in, and I helped lower my brother into the ground. That was the last time I participated in a burial. It made me sensitive to death again. There's no way you can escape that. So if this bill brings better controls for pharmaceutical companies, if this bill brings better treatment for people that are addicted to opioids, we need to support this bill. I thank you so very much, Representative Olson, for bringing this up. So with that, I'm just going to remind you that we all share the moral imperative to support House File 400. Thank you.
Representative Albright.
Thank you, Mr. Speaker and members. And Mr. Speaker, would the author of the bill rise for a series of questions?
She will yield. Representative Albright.
Thank you, Mr. Speaker and Representative Olson. We've heard a lot about the litigation that occurred in the state of New York based upon a similar bill that they passed in 2018. And I'm just wondering if the legislation that we have before us today has the potential for a similar court challenge.
Representative Olson.
Thank you, Mr. Speaker. I will just point out my graduate degree is in theology, but I'd be happy to speculate on a court case. But I would like to say that this bill does not have the Commerce Clause, the pass-through part that was in the New York legislation, which I imagine you might be referring to.
Representative Albright.
Thank you, Mr. Speaker. If the author would continue to yield.
Representative Olson will yield. Representative Albright.
Thank you, Mr. Speaker. Representative Olson, if one of the goals of this bill is to reduce prescription opioids dispensed in the state, but the annual assessment of manufacturer or wholesale registration fees remains the same year after year, how will that affect the cost of prescription medicines?
Representative Olson.
Thank you, Mr. Speaker. The overall goal isn't just to drop prescriptions down, it's to stem the tide on a crisis that's impacting every corner of our state.
Representative Albright.
Thank you, Mr. Speaker. And if she would continue to yield.
Representative Olson will yield.
Thank you,
Representative Albright.
Thank you, Mr. Speaker. Representative Olson, what protections are included in this bill that would protect patients with a legitimate prescription for opioids from seeing their costs change due to the fees assessed on manufacturers and wholesalers?
Representative Olson.
Thank you, Mr. Speaker and Representative Albright. Well, I think Representative Howard pointed out that prior to this legislation even being passed, that we've already seen prescription costs going up. And when I have asked manufacturers and distributors in my office, I said, what keeps you now from doing? They said, nothing. And why would you do it now? And they simply said, we don't have a reason other than profits.
Representative Albright.
Thank you, Mr. Speaker, and thank you, Representative Olson, for those answers. Members, this is not a subject that we disagree on. This is not a subject where any one of us could stand up and describe the tragic loss of a family member, a neighbor, a community leader, or someone of a constituent in our district. That's not the point. You know, when I look at this bill and I see the provisions in there, I was troubled as we went through the amendments by some of those that were rejected by the majority. We rejected the Zerwas amendment to exclude injectable opioids that are only used in hospitals. Some might say it's a carve-out. But if you're in the hospital and you need something like that, is there the proclivity that it might not be available because of cost? Because it's not on someone's formulary? Because of what we've done today? We rejected, or the majority rejected, the O'Neill amendment that would add additional manpower to BCA. Now, from my perspective, DHS is not in law enforcement, the BCA is. And when you add just a few more people, I think sometimes the difference between an intervention or stopping something illicit from happening happens with the BCA, not with DHS. Now, I understand that it wasn't part, and we want to watch to see how this all plays out. But people and members, this is happening right now. And to reject the addition of 2 more people that will be covering the state and trying to interdict on behalf of the citizens who might fall prey to those that are selling or providing illicit drugs, I wonder why. We rejected another Zerwas amendment, you did, that would ask the council to consider the data that would have considered illicit opioids, such as heroin, or fentanyl, or methamphetamine. I'm not going to be trite about it, but I think sometimes as we've discussed the opioid crisis, I think it feels a little bit like a game of whack-a-mole. Because here we are talking about opioids, but in the same breath, we have a crisis with regard to methamphetamine, with illicit heroin, with fentanyl that's coming in from all over sources that we don't know how it's happening, which goes back to the other issues. This is a cyclical problem. So even in the title, when we talk about opioids, why isn't it about substances? Why isn't it about illicit drugs? Words have powerful meaning, and when we're talking just about opioids, I wonder if we're missing the cyclical nature of what other illicit drugs are occurring and that have occurred and that will occur again for the sake of the folks who call Minnesota home. And finally, as has been mentioned a couple times, we rejected the doubt amendment that would have appropriated money from the general fund. Say what you want about the rules of points of order and whatnot, but it goes back to my first point. The very testimony that has been given on this floor will be used against the state in a court of law. Because what I hear about here is it's a punitive action on the part of us in this body against people. I'm not disagreeing with the fact that they have done wrong. But the words that we have been used in this chamber will be used against the very people who we're trying to save in a court of law by the people that we're trying to engage with to solve this problem. It was said by one of the other members on the other side that we enacted the tobacco lawsuit and put money where it was most important. I would remind the body that that tobacco settlement happened before this body took action. I'm sorry to everyone in the chamber in the gallery up there. Your tragic losses cannot be felt by us. We're trying to fix a problem that has enormous consequences. And so I'm very, very sorry for your loss. But this body is not about litigation. We are about legislation. And legislation typically comes in response to litigation. This is a bill that is intentioned towards the right purposes, and I applaud both Representative Baker, Representative Olson, and all the other members of this chamber, as well as others in past who have tried their hardest and put blood, sweat, and tears into putting this legislation in front of us in a capacity that goes after the issue. Does it hit the target? I believe it does hit the target. Could it be made better? I believe it could be made better as well. I'm concerned that the focus is not exactly where it needs to be. Thank you, Representative Olson, for your tireless work, as well as Representative Baker, again, for your efforts. Thank you, Mr. Speaker.
Representative New.
Thank you, Mr. Speaker. I think all of us in this chamber agree that we need more accountability. We need resources available to help those who need the help. But I think that reasonable people can certainly disagree on the funding mechanism for this, and that is certainly where my concern lies. Over the last year, actually about a year ago, I attended a seminar on opioid abuse, and certainly I am someone who has been touched by addiction, as I suspect everyone in this chamber has. But this particular seminar was quite eye-opening for me. And we talk a lot, particularly with opioids, in terms of a crisis. And we don't use that same terminology with other addiction. Although, as Representative Albright alluded to, I think perhaps we should. But I started after this seminar talking to folks and asking them their thoughts on this. And I spoke to an ER nurse and asked her, the opioid problem, is it a really big problem or is it a crisis? And she said it's absolutely a crisis. And that same day that I talked to her, she started her shift at the ER in a rural hospital that evening. And 3 hours into her shift, she texted me and she said, I have already dealt with one overdose and I have dealt with someone coming in seeking opioids. It was a crisis. I talked to a cousin of mine who's a deputy in Wisconsin, and he talked especially about the 94 corridor and what a problem that is. And he said that they pull over cars all the time coming from Chicago to Minneapolis, and they're filled with drugs. And then they pull over cars going from Minneapolis to Chicago, and they're filled with money. They're filled with cash. It's a crisis. I talked to an EMT who runs the ambulance every day. and he is constantly dealing with folks who have overdosed. And he said it is absolutely a crisis. That no one in this chamber is disputing the problem. No one in this chamber is disputing the fact that we need to fix this, and we need to provide resources and support to help solve this crisis. And in fact, I think most of us, probably those of us who were here last year, voted in favor of funding to help take care of this opioid crisis. I certainly did. But this bill is very different, and I'm wondering if the author would yield for a question.
Representative Olson will yield.
Thank you, Mr. Speaker. And Representative Olson, I'm wondering, for me, the devil is always in the details. And as I read through this bill, and I've read through it multiple times, I've checked with staff to see if they can give me a better answer, and I'm not finding one. On page 8 in subdivision 3, talks about determining the manufacturer's registration fee. And on line 8.28, it talks about the total number of units, and that's what this fee will be based on. But try as I might, I cannot find a definition for that unit. And I'm wondering, Representative Olson, if you can direct me to where I can find that definition of a unit.
Representative Olson.
Thank you, Mr. Speaker, and great question, Representative New. I don't believe you sit on any HHS committees, but we actually had that discussion in HHS, and we had Dr. Cody Weiberg, who is the head of the Board of Pharmacy, and he came and answered that exact question for the members of the committee, that there is a way that this is exactly measured already and monitored by the Board of Pharmacy and is within the realm of what they are aware of and are able to track. And I'm sure Dr. Weiberg would be happy to sit down with you and answer that question in more detail as well, too.
Representative New.
Thank you, Mr. Speaker. And Representative Olson, unfortunately, we're voting on this bill tonight, and I don't have the opportunity to sit down with Mr. Weiberg. So I'm wondering, Representative Olson, if you can give me a basic definition of that unit.
Representative New, are you asking Representative Olson to yield?
Yes, Mr. Speaker. Thank you.
Representative Olson will yield.
Thank you, Mr. Speaker and Representative New. So a unit is whether it is a prescription, a pill, or a liquid dose, or it's a measurement of the amount of opioid. And so it's something that's already, it's defined by the Board of Pharmacy. It's measured in whether it be pill form or in liquid form. It's defined already.
Representative New.
Thank you, Mr. Speaker. And would Representative Olson yield for another question?
Representative Olson will yield.
Thank you.
Representative New.
Thank you, Mr. Speaker. So my question is to dig a little deeper into this with those number of units. Can you tell me, Representative Olson, if this is a particular pill or a dosage of a liquid or an injectable? Does it matter what the dosage is? If it's a 10 milligram dose or a 15 milligram dose, or I know some of these different opioids can be an 80 milligram dose. Does that dosage play into the unit? Is it exclusively a pill? Do we know that level of detail on how those units are determined by the Board of Pharmacy?
Representative Olson.
Thank you, Mr. Speaker, and thank you, Representative New, and I really appreciate your level of detail. And one of the things as a legislator that we're doing in this piece of legislation is we are equipping the Board of Pharmacy to do their jobs. I am not a pharmacist. I have not done studying that, but we have a Board of Pharmacy that already knows how to do this, already measures those units of sale, already understands it, and has been vetted through many committees, and we appropriate money in this bill for the Board of Pharmacy to do the work of the units of measurement in this bill. And I'm confident in the work and the vetting we've done all this to already know that we are putting the work in the right hands where they're already monitoring and defining that.
Representative New.
Thank you, Mr. Speaker, and thank you, Representative Olson. I actually do have some concern with this. I have some concern that we don't know exactly how these units are determined. We are trusting the Board of Pharmacy to do that. Representative Zerwas discussed a little bit about the uncertainty that comes with this. and that the folks who will be paying these fees will not know what those fees will be until after they've been prescribing and they've been those units have been coming into the state. I have a little bit of concern. My late husband was on a ventilator for a year, and being on a ventilator, and particularly with things that involve respiratory issues, there's a lot of anxiety involved in that. And what they found is that opioids are actually the most effective way, they're the most effective treatment for anxiety specific to those respiratory issues and ventilator issues. And so my late husband was certainly on opioids, and they were really critical to his care. But I have some concerns when we don't know how these units are defined, if this is based on a dosage, if it involves the strength of a given pill, or if it's just a pill. I think this actually matters. I think that we spend a lot of time legislating details. In fact, we've got a 20-page bill here, and I don't think it's unreasonable to define things like what a unit is. I don't think that's unreasonable. And instead, we're leaving this up to the Board of Pharmacy to determine. And while I'm sure they do a wonderful job, this is certainly not something that they've been doing to this point. And I see a lot of concern with that. I hope that as this bill goes into conference committee, that we will consider some additional details in how this is moving forward. Again, everyone in this chamber believes that we need to do something. Again, most of us voted to do something. If this bill was moving forward with general fund dollars, I would be supporting it right now, tonight. There's no question about it. But with this funding mechanism, members and Mr. Speaker, I would encourage a no vote tonight.
Representative Robbins.
Thank you, Mr. Speaker and members. First, I would like to thank Representative Baker and Representative Olson for your work on this. I do have the privilege of sitting on HHS, and I was able to hear the committee in detail in the discussion and meet many of the families who came to testify. And this has been by far the hardest vote I've taken as a new legislator. And I want to thank Representative Olson for accepting my amendment to allow for home disposal kits. My family and friends have also been touched by the opioid crisis, and having that piece in the bill was very important to me, and I'm very grateful for your taking that. I have to say that I will be voting against the bill tonight because of my concern about the funding mechanism, which I also raised after the committee. I didn't raise it during committee because I just didn't feel like I knew enough, but I did talk to the authors afterwards. And my concern is that this will just end up in litigation, and we won't get the good work that needs to be accomplished through this bill done, because it will be tied up. And although the bill itself doesn't speak to money for litigation, the fiscal note does provide $200,000 towards the AG's office for expected litigation. So I do think that's a real concern about this bill. And my proposal at the time after the hearing, when I was talking to Representative Baker, was as we know, this bill is currently in, this issue is in litigation, and Minnesota already has a lawsuit pending against the pharmaceutical company that is been behind a lot of the opioid crisis. That will eventually result in, I believe, a favorable decision that will bring opioid money like the tobacco settlement. The tobacco money is currently bringing into the Minnesota General Fund $691.3 million every fiscal year. Colleagues, 22.25 million of that goes into a health center, 3.94 million of that goes into education and research, but every year, $665.11 million goes from the tobacco settlement into our general fund. And we could easily take $20 million out of that money and put it into this purpose. And I did suggest that to the authors, and I am glad to see Representative Doubt's amendment to a similar effect. But I think we should the reason I'm rising to speak on this is I'm hoping to get on the record as it goes into conference committee that that's the best solution, that we take $20 million out of the tobacco money and put it towards this, and then if there is a settlement on the lawsuit that's currently going on, then we can see about taking that money instead of this money. But there is money coming in from the tobacco settlement. I know it was mentioned that the Clearway, Minnesota is going away. That is true, but that doesn't change that the tobacco money will continue to come into the general fund. So members, I think rather than not getting the work done of educating and helping with the opioid crisis by getting this bill tied up in litigation, we really should support the goals of this by when it goes to conference, having the money come out of the tobacco settlement. And I urge a no vote, and that as it goes through the process, that perhaps that could be the outcome. Thank you.
Representative Bennett.
Thank you, Mr. Speaker. Members, I really want to vote for this bill. I want to vote for it for those people up there who have been tragically touched by the death of a loved one. I want to vote for it because of Representative Baker's son. For the other members here who have spoken and been touched tragically by this really terrible epidemic. But I can't. How can I go home and tell my constituents who have asked me to work on lowering the costs of health care? How can I go home and turn around and say, okay, I'm working to lower your costs of health care, but now I'm going to vote to raise the costs of health care? Because this will raise the costs of health care. I'm not sure who in here is hearing from Big Pharma, but I'm sure not hearing from Big Pharma. I've never even talked to them before. I wouldn't even know who they are. I'm hearing from my constituents at home. I'm hearing from my senior friend who just had surgery, who needs pain medication for a short period of time to get through her tough time. Or the farmers who are already struggling under huge health care costs, health insurance costs. And you know that insurance will go up too, because we're all going to pay for these increases, whether it's covered by insurance or covered out of somebody's pocket. So I cannot in good conscience do that. I really hope this bill will come back from conference committee and working with the Senate in a better way, with a better funding source that we know will be reliable. It's not going to go away because a lawsuit gets slapped on our state for this. And coming from the general fund instead of slapping fees on companies that are going to be paid by us, the consumers. So I feel bad that I can't vote for it, but I certainly hope I'll be able to vote for the end product when that comes out. Thank you.
Representative Stevenson.
Thank you, Mr. Speaker. And I wanted to rise today to talk a little bit about this funding mechanism that's causing all this consternation on the floor today, and address specifically the idea that if we were just using general fund dollars to fight the opioid epidemic, that this would be an okay enterprise. Well, what I want to tell the chamber is we're already spending general fund dollars on combating the opioid epidemic. We are spending millions of general fund dollars on the opioid epidemic. Those dollars are being spent in hundreds of ways, both big and small. Your general fund tax dollars are being spent to operate jails and prisons that house thousands of people whose addiction have led them down a criminal path. General fund tax dollars pay for treatment beds and outpatient programs. They fund child protection work, which has exploded in recent years due to the opioid epidemic. In fact, I'd ask every member here to go to their local county attorney and ask them how their child protection caseload has grown in recent years. In the county I work as a prosecutor in Hennepin County, child protection costs increased to $122 million in 2016. That's more than double what it was just 8 years ago. In 1 year, the amount of child abuse cases in Hennepin County increased from 11,000 to 22,000 cases. And so the idea that we would make this bill better, that we would improve it by just using general fund dollars is wrong. General fund dollars are already being spent, far more than the $20 million at issue in this bill. This bill is about accountability. This bill is about ensuring that the corporations that have made millions upon millions in profits from opioids are part of the cleaning up the solution, cleaning up the mess that they created. Because the taxpayers of Minnesota are already paying. The manufacturers and distributors of opioids, the pharmaceutical companies, they're the ones who need to contribute. They are the ones who need to be held responsible. And whenever I think about this issue, I think about one person in particular that I encountered a few months ago, and she was a woman who was struggling with a terrible addiction to opioids. And I met her while I was working my day job as a prosecutor for Hennepin County. This woman was on felony probation, and she had violated the terms of her probation, and I was assigned to handle her case. And she was in custody, and it was a matter of public interest that she remain in custody because she was pregnant. And it was understood by everyone who was involved in this case that if she was released from custody before she gave birth, that she would use again, and that the child would be born addicted to opioids. And we understood that not because opioids are terribly addictive, although they are, and we understood that not because people who are released from jail are at a heightened risk of use and overdose, although that's true as well. We knew that she would use again and that the child would be born addicted to opioids because this woman had had 5 previous children and 3 of them had been born addicted to opioids. And I was relating this story just the other day to someone who works at HCMC. And they said to me, you know, it used to be the case that we would have at HCMC about a dozen cases a year of a child being born addicted to opioids. And right now that number is more like 6 to 12 a week. A week. And so, members, the costs that the people of Minnesota are paying because of the opioid epidemic are very real. They are real in dollars and in tears. This bill is not about those costs. This bill is about accountability. It's about ensuring that the companies who made this mess are part of the solution. And that's why I'm pleased to support it just the way it is.
Representative Detmer.
Thank you, Mr. Speaker, and most of you know I don't get up that much and speak, but one thing that was not brought up tonight in all the discussions is what the opioid problem is doing with our military. The use and abuse of prescribed controlled substances are concerned by the Department of Defense because of their potential impact on our military readiness. The health and well-being of military personnel and their families, and associated health care costs. Among military veterans, opioid use has been associated with post-traumatic stress disorders and other mental health issues and substance abuse diagnosis. And among those with pain conditions, notably lower back and migraine headaches. And the growing rate of opioids prescribed for younger veterans is a big concern. And I want to thank Representative Baker and Representative Olson for bringing this to the forefront. Just think about it. If our side of the aisle was in the majority, Representative Baker would be discussing his bill tonight. And I think some of our amendments that we tried to get on would have made this bill a much better bill. And, Mr. Speaker, would the author yield for a question?
Representative Olson will yield. Representative Detmer.
Representative Olson, when you take this bill to the conference committee, will you do your best to bring it back to this body so that you can get 134 votes from this chamber? Because you're going to have to be working with the other house. And this is an important bill for our communities. in my case, for our veteran population and their families, that you can bring back a bill that we can all support. Thank you, Mr. Speaker.
Representative Olson.
Thank you, Mr. Speaker and Representative Detmer, and I appreciate your passion for this issue and you speaking to that. Well, I would say we have the opportunity for 134 green votes today on a good bill that really doesn't wait for further action, and I will do my best to continue to work hard and have worked incredibly hard to make sure we can pass a bill off this floor we can be proud of.
Representative Detmer.
And thank you, Mr. Speaker, and thank you, Representative Olson. And I know you feel that you've got a bill that you can get 134 votes, but we know that's not possibility without some of the amendments that we wanted and the funding mechanism and so forth. I sat here and just listening to all the different amendments, and there were some good ones there, and I wish we could have got some of those on. But I'm looking forward to after the conference committee. Thank you, Mr. Speaker.
Representative Drazkowski.
Thank you, Mr. Speaker. Members, thank you for the debate. Representative Olson, thank you for your work on the bill. Representative Baker and others. I won't be supporting the bill tonight. I listened intently and have read the bill multiple times here on the floor tonight. And while there's some good sections to the bill, I mean, I was heartened to read Article 3, because previously in this debate there really wasn't a discussion on how we start to meter or provide the natural reduction to the appropriate amount of opioids going out between the doctor and patient relationship. And I think that sections 2, 3, 4, 5, and 6 in Article 3 start to do that. But members, I think there's a lot more in that arena that actually needs to happen. Instead, what we have is a bill at a time here that we have a $1 billion plus projected over collection of the people's money, a bill that brings forward a new tax. This bill contains a prescription drug tax on Minnesotans that will raise the cost of prescription drugs for those Minnesotans that happen to need opioids. It will also, as Representative Bennett and others have mentioned, increase the cost of health insurance. There's an additional mandate added to the long list of the 64 or 67 state government mandates that form the gold-plated Cadillac coverage that everybody has to buy but they can't afford. The Cadillac just got another couple inches longer and another 80 or 90 pounds heavier with this bill. And so we have before us a bill that institutes a new tax, and one would have to ask, why are the Democrats bringing forward with this bill a new tax when we have $1 billion, 26 times as much as this bill spends? $1 billion in the next biennium of overcollection that's projected. Now, of course, Republicans would like to give that $1 billion back to the people who it hasn't been collected from yet, and we've heard that, and you've heard me talk about that and others. And Democrats would like to spend it all. But members, we haven't even got to the spending yet. Those decisions haven't been made. And yet we have before us a bill that's going to increase taxes on Minnesotans by $40 million each biennium. So I heard Representative Halverson say, well, we're going to ask drug manufacturers to do this and that. We need to be reminded, members, a tax and the force of government that drives and enforces that tax has nothing to do with asking anybody anything. The force and dictates of government, if this bill passes, are going to force drug manufacturers to cough up $40 million every 2 years, which they will turn around and increase the cost of their prescription drugs to the people of Minnesota, who will have a new tax on them that they'll have to pay Their health care costs will go up because of that, and their insurance costs will go up on top of that because of this bill, because of the additional mandate that's in there that I mentioned earlier. So why? Why are we putting a new tax when there's plenty of money? Representative Robbins mentioned her idea. There's money from the tobacco fund coming in. State government has money all around us of the taxpayers, the people of Minnesota, flooding in here. Billions of dollars that hasn't been spent yet. And the Democrats bring forward a bill to grow government and increase taxes even more. Now, I heard the word punish from Representative Stevenson here, and I don't know, is it a punitive thing? Do they want to get back at the drug manufacturers thinking they're going to get some height out of them with this and feel good about it and go home and brush yourself off and I did good today? Well, the people who are really punishing with this bill, members, are the people of Minnesota who have to buy health care in the future and haven't bought it yet. That's who this bill is punishing. And the $40 million every biennium is turned over largely to a government, most of it the Department of Human Services and a good amount to the Department of Health. I don't have to remind you, members, the Department of Human Services has a fraud and corruption problem that runs deeper than this state capitol building that we're in. And it hasn't been solved yet. We haven't addressed it yet. And we're creating a pile of more of big government in this bill, thinking this is going to help people. How is CCAP doing? Half of the money there is projected by the auditors or by the inspectors that inspect the program within DHS to be going out fraudulently. We got over $300 million in just 5 months out of the year in Medicaid funds that are going out fraudulently out of the Department of Human Services. Members, we're going to create another program to turn over to the Department of Human Services, think they're going to solve the opioid problem in Minnesota. Well, good luck with that, because government has failed at the things that we have given it. We haven't addressed that failure, and we're going to give them another big program funded by punishing tax dollars extracted from the hardworking people in Minnesota that happen to be sick. Members, that's a recipe that this member's not signing up for. That's a recipe that's not in the best interest of Minnesotans, not in the best interest of our economy, not in the best interest of health care, not in the best interest of solving this problem. As I mentioned, there's a few good pieces in this bill, and I congratulate the authors on that. And I've seen some movement this year in this bill compared to what we had last year in that direction. I think there's a lot more in that area that could happen, but there's a whole bunch in this bill that's so problematic. Members, we don't need more of the people's money here. There's some other reason that this bill contains these punishing taxes. And I encourage you and everyone in this chamber to join me in voting no on this bill. Let's go back to the drawing board, get a bill that works for Minnesotans and doesn't bankrupt those that are involved in health care. Thank you, Mr. Speaker.
Representative Becker-Finn.
Thank you, Mr. Speaker. Members, I'm going to bring us back to the bill and what this bill is about, because this bill is about taking care of Minnesotans and their families. Specifically, we've talked about a lot of numbers and statistics so far, but I want to bring your attention to a few more. In 2016, African American Minnesotans were 2 times more likely to die of a drug overdose than their white counterparts. In 2016, Indigenous Minnesotans were 6 times more likely to die of a drug overdose than their white counterparts. 6 times. That's a lot. These disparities in the overdose deaths in our state are the worst race disparities in drug overdose mortality in the entire country. And I know some folks don't like to talk about disparities or talk about race or class or the things that do exist, but they exist whether we talk about them or not. We talk about those disparities and inequities a lot, and all those other disparities, poverty, racism, educational outcomes, sexual assault rates, trauma, adverse childhood experiences, these disparities layer on top of each other and impact who lives and who dies in this opioid epidemic. And it speaks to the pain experienced in some of our communities, pain caused by those disparities, because that is what the opioid crisis is really about. It's about pain and how we deal with that. This is not to say that any family's loss is more deserving of attention than any other. Any death is one too many. But when we know that those disparities exist, it is on us to act. As we address disparate impacts on the health of our communities, on farmers, on veterans or other groups, it is just as necessary that we address the disparate impacts on our Indigenous and African American friends and neighbors. So I thank you, Representative Olson, and all the others that have poured so much into this bill for recognizing these disparities and meaningfully including and engaging with Indigenous communities. The first hearing for this bill was an informational hearing in Mille Lacs. That's never been done before. Thank you for turning off your computer, Representative O'Driscoll. The first hearing for this bill was an informational hearing in Mille Lacs. And that was incredibly important because you all on that committee, Chair Moran, you went up to Mille Lacs and you listened to people and you listened to them where they are. So thank you for doing that. That is really what our job is about. And I thank you for including culturally specific addiction and prevention programming in this bill. Acknowledging the disparities that exist in the opioid epidemic and in overdose deaths, and then changing the way we address that problem, that is how we right this ship. That is how we save Minnesotans' lives. So I am grateful to you, Representative Olson, for leading on this issue. It is so clear to me that you hear the stories of the families and you internalize that and you use that as a resolve to act. So I thank you for your leadership on this, and Representative Baker and everyone else who's put so much time over really the years into this issue, and we're finally here voting on a really good bill. That's why we're here. That's why we do this job. To lead in a good way. It's a good bill that I'm very proud to support. Vote yes, members.
Representative Kotitsa Watude.
Thank you, Mr. Speaker. I rise today in support of House File 400. I rise today to shed some light on a perspective that we don't necessarily hear often in this conversation. The voices of parents who have lost children are loud and brave and strong, and I commend them. Thank you, Representative Baker, for using your voice. Thank you, Representative Olson, for your work on this issue. But we don't often hear from the children who have lost parents, the children in out-of-home placements across the state of Minnesota. Just in my county, Hennepin County, in the last 10 years, we have seen a 96% increase in the number of child abuse and neglect cases involving opioids. We've also seen an 88% increase in the number of children between the ages of 0 and 5 being removed from their homes. I am a licensed foster parent in Hennepin County. My children are between the ages of 0 and 5. Representative Stevenson mentioned that Hennepin County spends over $122 million on child protection annually. That's a staggering number. The amount of profit seen by manufacturers and distributors of opioids is also a staggering number. Our communities are hurting for these funds. Our children are being abused and neglected. And we, all of us in this room, can do something about it today. I urge you to support this bill.
Representative Johnson.
Members, I got a couple issues with this bill. One, there's funding for 2 BCA special agents, and part of their duties is to coordinate with the Federal Drug Enforcement Administration and also work on drug trafficking. We have a number of agents doing that now, and I'm sure that the director or the person in charge of all those task forces would love more help. But my concern is the funding is through this special assessment. And I wish we would have had an opportunity to hear this bill in the Public Safety Committee and Criminal Justice Reform, because it deals with employees of the Bureau of Criminal Apprehension. But there's no need to bring it there, according to what on the House floor last week. Now, the problem is with the funding, it stays static, the exact same number for 4 years in a row for 2 agents. Those agents have union contracts, and every year their salaries are increased by their steps. But the formula in this bill, it doesn't do anything. For 4 years, it doesn't stay the same. And at some point, that number has to change. Where is that other funding going to come from? Which area? And if we don't get that, if we're unable to raise that $20 million, we need to know how we're going to pay those employees. This bill doesn't address that. Now, if we would have accepted Representative Doubt's amendment to get the funding from the general fund, that would not be an issue. That would have been taken care of. But of course, we did not do that. Now, the other thing I'm going to talk about is the addiction itself. I worked at Drug Task Force working on numerous different drug issues. Meth was just coming in at the time, and meth was a monster. We took care of the meth issue, and the opioids took its place. Unfortunately, the meth is coming back like the monster it is. But the other issue we have is something that we do. In 2017, there was 422 unfortunate deaths in Minnesota on opiates. But what's more alarming, there was 1/3 more deaths, 636 alcohol-related deaths. But we don't consider that a crisis. Yet we have 33 bills to increase the access to alcohol in this chamber. We need to start thinking about what we're doing and really think close, because every life is important. The lives of every individual in this chamber, in this state. So with that, think twice about what you're doing on this issue. Think twice about and make sure you look at all the consequences of everything. Overall, there's some good things in this bill, but there's things I have concerns with as well.
Representative Hamilton.
Thank you, Mr. Speaker. Sorry I've been sitting too long. My muscles tighten up here a little bit. So, you ever go home at night and kick off your shoes, sit in your recliner, lean back, turn on the TV? What's the first commercial that comes on? A drug commercial, absolutely. You got an ache and pain, we got an opioid to help you out. What's the number 2 commercial? Did our opioid cause constipation? Well, you know what? We got a drug for that too. It's disgusting. In fact, some reports will tell you that more money is spent on advertising and marketing than on research. And then what happens? They leave us a mess, and they force us to clean it up. And we have individuals that have worked extremely hard to put a plan together, and what's their response? Their response is that the market will react accordingly. AKA they'll raise prices. Well, guess what? They're going to raise prices anyway. Case in point, my prescription that I receive for my MS every month is $7,500 for years until last month. We get an email that took it from $7,500 to $15,000 for no apparent reason. Explain that one. It wasn't because of any legislation that we passed here on the House floor. It's because of greed. I believe it's legalized theft, and I've said that a number of times, and I'll say it again. You know what? Their response, my interpretation, sorry, Mr. Speaker, my legs aren't working right. Now I'll stand up. Their response, my interpretation is, if you do not allow us to harm you and your constituents, well, our response will be we're going to harm you even more. It's ridiculous. If you've been on the receiving end of how cruel and how unfair this is, you'll look at life a little bit differently. I'm sick and tired of seeing people being harmed. I'm sick and tired of it. We have people making decisions as it pertains to our health, and they've never even seen us. They've never even met us. And many are practicing medicine without a license. We need to address this. And I applaud the authors of this bill. I applaud, because for far too long, people have been getting away with things that I believe have been reckless, if not criminal. And it's been deliberate. And we need to hold these people who are responsible, we need to hold them accountable. And it's as simple as that. Thank you for bringing this bill forward. And Chair Liebling, I have other bills that I want to work with you on to address many of the things that are absolutely wrong with this system. I ask for a green vote. Thank you.
Representative Lilly.
Thank you, Mr. Speaker and members. Just want to say hats off to my classmate, Mr. Hamilton, Representative Hamilton. Hearts out for you. I don't serve on HHS, but as everybody knows, I kind of went through a journey about a year ago, and I'll tell you that I actually want to take a little different tact on this. I actually want to thank the caregivers that take care of us. You know, you get in these situations and you're in a lot of pain, and things are going fast and happening, and you know, in a way, you're kind of, to be honest, you're kind of grateful for, you know, it's a surprise. You're grateful for these, you know, the smart people in the world that come up with some of these drugs and come up with it, and you're grateful for these caregivers that are taking care of you, and you don't know they're there. The doctors that are making these decisions, you're really not in a spot to make them. They're making decisions. I remember quite early in my deal, I had a nurse come in, and I'm begging for more, to be honest. I thought I was pretty tough, but I wasn't that tough, and I was begging for more drugs. I said, I want more drugs, and the nurse says to me, this guy, he says, you know, you're going to have to get used to this. And I had one good arm, and I was kind of hoping he'd come a little closer, actually, but he was smart enough to stay away. Probably would have heard about me on the news. But, you know, that's the reality. Your things are very different, and there's just no way, quick little editorial comment, there's no way men could handle childbirth, I'll tell you that. There's no way we could do what you women do. But I just want to thank Representative Baker, because, and Senator Eaton, I hate to talk about the people across the street, but Senator Eaton at the time, with their leadership, you know, they give you this stuff and it helps. And because of them, their leadership, I was scared to death. And, you know, you handled it differently, and I got off of it as fast as I could, and I was lucky. But the stuff really does help, and I was, quite honestly, I was glad it was there and helped me get through. But by your leadership and Senator Eaton's, Representative Baker, thank you. It helped me get through that, and I'm sure having this discussion today is helping other people too figure it out. And I hope we do pass something today, because you know, and get it to the governor and get it passed into law. And I'm okay with paying as we go and figuring it out. Of course, I'm a Democrat, I guess. No, I don't know, but I think it's important to pass it. I want to thank Representative Olson for carrying this, but the stuff really does it sneaks up on you, and I'm just grateful for that I was able to get past it. But it definitely does help the people when they're in pain. But Representative Baker, thank you, and I hope that we can put some green board or votes up there and get it to the governor eventually. And I believe there's a lot of people hurting out there, and we can do better.
Representative Dowd.
Thank you, Mr. Speaker and members. Thank you particularly to Representative Baker for the work that you've put into this. Somebody else acknowledged that had we been in the minority, you'd be the one standing up as the chief author tonight, but that's the way this place works. I think we know how passionate you are about this issue. And frankly, with the loss that you and so many other Minnesota families have experienced, we know this is an important issue. Thank you to the families who have lost loved ones who are here. I can't begin to imagine what that's like. I think each of us can say that we've been touched by addiction in one way or another, but I don't know that we can say that we've experienced losing a loved one. Not everyone has, and I hope that's something that we can reduce so that people don't have to experience that. I can't even begin to imagine. I had a friend yesterday morning who I was supposed to meet at 11 o'clock, and this isn't a friend that I've actually known all that long, but he texted me at about 8:30 and said that he couldn't meet at 11, that he had to go to a certain place and pick up his sister. And I didn't know anything about the situation. Didn't know, he had never talked to me about his sister before. I didn't know anything about the situation. But I immediately knew from where he said he had to pick her up that there was an addiction problem. And I immediately said, "Is everything okay?" And he said, "She's an addict, and I'm praying that she finally wants to get help." And I immediately said, "Do you want me to go with you? Is there anything that I can do?" Because I know that what addicts need is love. More than anything else, they need love and they need support. And not just they need it, it's incredibly difficult for the families of the people that are going through that. Addiction is something that just takes over their bodies. They don't have control. They may want help, they may want to stop, but they can't. The drug or the addiction just simply won't allow them. What they need is love. And I fear what we've done here, and I know that those who have lost someone to addiction have a hate in them that I cannot understand. I can't even begin to understand the hate you must have for anybody that you think is responsible, and that includes drug companies, right? I'm not gonna stand here and say that I can even relate to what you might be going through. But when I look at this bill, what I can see clearly is that we've let hate get in the way of love. In 2017, 422 people in the state of Minnesota died from an opioid-related death. 422 people. I don't know what that number was in 2018. I don't think those numbers are out yet. If they are, I haven't seen them. 422 people. And I want you to ask yourself, just forget about everything you know about this issue or this bill. Knowing that 422 people a year, and I will just about guarantee you it's more than that now. That number has gone up 681% since 2000. So I'm quite certain it's higher now than it was in 2017. But forget about everything that you know about this bill or how we got here. Look at that bill sitting in front of you. I don't know if all of you requested a copy. I guess I have one on my desk. This is the best we can do for those people? This is it? Is this what you campaigned on? Do you know that in this bill, not one person will get help for over a year. We have $1 billion surplus right now in the next biennium, and plenty of other pots of money. And $20 million around here is nothing. Is this really the best we can do? So June 1st of 2020 is the first time that money could be available, and I guess I don't know enough about how quickly that money will come in, but I'm going to assume by the time they get it in and by the time they start spending, I'm just going to say a year and a half from now before we help anyone with this bill. A year and a half. So extrapolate it out in the numbers from 2017, that's 633 Minnesotans that will lose their lives to opioid addiction, and that's without any increase, and I guarantee you there'd be an increase. But I'm just using simple math. 633 Minnesotans will lose their lives between now and the time that this bill provides $1 to help somebody with an opioid addiction. This is our big opioid bill. I'm really proud to say that a year ago we passed a bill that had $16 million of money that would have been available immediately to help with this crisis. I agree with you, there is a crisis. Right? One of my friends was affected by it yesterday and probably will continue to be affected by it for months and months and maybe forever. And I pray that his sister gets the help that she needs and that he has the support structure to get her through that and support her through that, because it's not easy. But this bill, if this is the action we take, this is the best that we can do, this is what's wrong with government. We have $1 billion surplus. We have pots of money laying all over the place. And we can't help anybody for a year and a half? What are you going to say to the families of the 633 people that will die before this bill helps a person? And believe me, I know that there's a lot of hate for drug companies. I get that. I don't totally understand it because I haven't experienced it myself. And I don't want to dismiss that for 1 second. But unfortunately, we've let that hate get in the way of love. The love and the support and the dollars and the treatment dollars that frankly are needed immediately. And there's some money coming from the feds, and yes, we do spend some money currently. But our big opioid legislation this session isn't going to help somebody for a year and a half. This is what's wrong with government. This is what happens when government steps in and says, we've got a solution for you. We're going to help people. I can't vote for this bill. And do you know what? I might offer amendments from now till the end of session on everything I can get a hold of to actually put some money into real opioid addiction help immediately, because people need it. It really is a crisis. And by the way, we should do that next session too, because we'll have this session and the entire next session before $1 from this bill helps anybody affected by the opioid addiction in this state. A year and a half before one family feels the benefit of the money in this bill. So I know, I can tell that we've let the hate get in the way. Frankly, I think this bill needs to go back to the drawing board. And Representative Olson, I want to thank you, because the things that you're spending the money on in this bill are really, really good. They're so good we should do them right now. And we've got money laying all over the place, $1 billion worth of it. Let's spend it. We've got such an opioid crisis, and it's such a priority that we're not helping anybody for a year and a half. That's what a crisis it is. When we've got $1 billion surplus laying around, and this is such a priority for us that we're not willing to spend the extra money we have right now to help people right now. All rhetorical questions. But ask yourself, look at the bill. Is this really the best we could do? This is the best government could do to help people in this state with this crisis. Not only that, you are literally voting, the solution that you've chosen will raise the cost of health care in this state. You've heard numerous people here say it. No one has disputed it. They know that it's going to happen. And if this bill really is about punishing drug companies, you're not even doing it. You're not even doing it. They're just going to pass this cost along to their customers. And that's what will raise the cost of health care. If you want to punish drug companies, bring a bill forward to punish drug companies. We'll have a debate about that. I'm not sure they'll even get money in a year and a half, because this one's certain to end up in court, just like all the others in all the other states. You know what wouldn't end up in court? If we just prioritized this crisis and appropriated money that we have right now to deal with this crisis. I actually worry too about whether there's an unintended consequence here. I don't know what percentage of these drugs are misused and thereby giving us the number of these or percentage of these opioids that are used for the purposes that they're needed. But the people that need them, as our deputy minority leader said here, need them. They provide some good quality of life, maybe at the end of life or in other situations, post-surgery. Will pharmaceutical companies just stop selling here because of the unknowns that we've talked about? We offered amendments tonight that talked about the fact that a pharmaceutical company will have no way of knowing how much their fee will be because they don't know what percentage of the market they are. This bill doesn't calculate the number of pills that they sold or the dollar amount that they sold. It literally says based on the percentage of the market that you are, this is how much your fee is going to be. Well, we don't know that. They won't know that until it's over with. So will they just say, with that sort of uncertainty, we're just not going to sell our products in the state? And then the people that need those won't have access to them. Is that the unintended consequence that'll happen from this bill? I don't know. I mean, I hope not. But with all of those questions and such a crisis on our hands right now, is this really the best we could do to help people a year and a half? That's how quick and how swift we react to a crisis in Minnesota? To provide dollars a year and a half from now. To me, this is one of those moments in the legislature when you ought to just stop and say, you know what? There's a problem here. There's a crisis in this state, all right. And this chamber's response to it is, we're going to let 633 more people die before we appropriate $1 to solve that crisis. Let's let the love take back over the hate. And that's not always easy in the world, let alone here in this chamber. But let's provide the families, like my friend who I talked to yesterday, with the resources and the dollars they need for the treatment that is necessary to help their loved ones cope and get over this addiction. They need those resources. We need those dollars. Not a year and a half from now. We need them now. I don't want to let 633 more people die before they get $1, because that was our solution. Please stop and think about what you're doing. This is one of those moments. Just think, is this really our solution? I can't vote for this because I know that we together can do better. You ought to send it back to committee. Let's fix it. Let's come up with a bill that actually helps people today, and let's pass it with 133 green votes, soon to be 134. I want to vote for this bill. I want to help people. But unfortunately, this bill does not help anyone. And don't think for a second you can go back to your district and tell anyone that you've helped someone with opioid addiction. Because when you were confronted with a crisis in this chamber today, the best solution that you could come up with was to provide dollars that can be accessed a year and a half from now. We ought to all be ashamed of ourselves. There's some important programs in this bill that deserve funding now. Let's fund them. But don't vote for this bill. Thank you, Mr. Speaker.
Representative Baker.
Thank you, Mr. Speaker. Well, if I'm talking, it must be time to wrap it up pretty quick, and we'll do that. A lot of things have been said on the floor that make one pause. You know, what we're doing here is we're doing it the hard way. We're doing it in a way that isn't traditional, and it isn't just spending more money that we might have today. And you heard a lot of folks that love the bill, and a lot of folks that had a lot of concerns with the bill. And that's why we're here today to talk about this at 7:30, and we've got still really important bills coming up yet, because this bill takes a lot of work. I agree that this bill isn't right. I said that before. It's not perfect. I've never seen a perfect bill, but we're going to get it better. I think there's going to be a lot of general fund money this year because we can't go without for the next 1 to 2 years. I think we should do a really good bill with general fund right now, and I'll be working with Chair Liebling on that and her team about making sure that that is funded. But what I think makes this bill right is because we're doing something for future generations, for future kids, that we can't predict today what our biennium is going to look like in 2 years or 4 years or 6 years. And so what I am, though, is I'm tired. I'm tired of fighting every 2 years to get everything I can to help with this issue of addiction. And this was my idea a while back. Let's ask manufacturers and distributors and providers to come to the table and give us a hand. I'm doing it because I think it's the right thing to do, not the easy thing to do. But I get real tired, too, as Representative Hamilton brought up. You get these folks out here that like to hand out stuff to tell you how it might affect access to the medicine. It might raise the cost. But where are we when they're raising the prices every other day or once a month or whatever they do when there's so many of them? You can't keep up with it. But we don't yell and scream on the floor when that's happening. But you're thinking it could happen, and it might. I don't know. We aren't telling them what to do with their pricing, because that's what New York got in trouble with when it threw it out of court, because they had some language in there that we don't have. So to the folks that did come to my office and for the last 3 years have been telling me how concerned they are and they like the policy of the bill and we like the limiting the drugs and we know there's a problem and we're doing this, we're doing that, but it never comes back to what are they going to help us with financially. That's never part of it. So we tried. Mentioned earlier that opioids have risen since the year 2000. We've lost 680% increase in deaths from 2000. We only had 54 deaths of opioids in the year of 2000, and now we have over 400. It's insane. These numbers came out today. So we've had the folks from the company that brought us OxyContin And now they've got some information that's come out in the press, and it's been part of the redacted emails that are now out there from these companies that'll be through the lawsuits. And what's disturbing is the founder, the chairman, or whatever, and I'm trying not to use the name, that's fine. But I will tell you that what was appalling to me was, and as I try to write legislation that isn't emotional, is when you've got a company like this that brought us this stuff, and 5 years after it was launched, they had the audacity to start diverting the blame of why this crisis got out of control. And I quote, "We have to hammer on the abusers in every way possible," the chairman wrote in an email in February 2001. "They are the culprits and the problem. They are reckless criminals." Well, let me tell you, my son wasn't reckless. He got injured. He never wanted to be an addict, and he never wanted to leave this wonderful earth. I get the fear for litigation. I get it. So what's our answer? Do nothing? Of course not. Why don't we stand up and say enough already? Let's take a shot at this. But if you're too chicken to vote for this because of litigation, well, there's a red button for you, right there. So just push the red button if you're afraid of litigation, because I'm not. And I hope a majority of our body isn't for that reason. I think that's cowardly. I think that's the wrong thing to do, because we've worked with the Attorney General, we worked with others to say, how does this look from your angle? We might be wrong, I don't know. But you have a red button if you think you're scared, and if you don't want to do it, that's your out. But I'm just so tired. I'm so tired of trying to do this lift, and we could have just done it with general funding. I get it. I know this is a tough vote. I get it if you can't support it. It will come back better. I promise you that. Dan was born on February 15th in 1986, up in Falls, International Falls at Falls Memorial Hospital. He was the first child for me, made me a dad. And Dan is buried in Aiken, Minnesota, where we finally grew up and graduated from high school, and that's where I will be with my wonderful wife, Mary. And people don't know what it's like, and I don't want you to know what it's like, and that's why I'm doing this, to lose a child. I don't want you to know what it's like to ever imagine that phone call or a knock on the door. And I don't want to make this emotional, because you can't write legislation like that. You can't. But we need general fund money. Not in this bill. This was not intended for that. That's not tonight's conversation. But I want to do something so we're set up for the long haul. I want to do something so we can focus on other things. But I don't know what it's going to be like in 2 years and 4 years and 6 years on our budgets, because right now I see them going the wrong direction in the future, and I'm very worried about that. So I'm just asking members to help me continue this journey. Let's get it off the House floor with as many green votes as possible. And you know what? Take a tough vote once in a while. If you have to go home to your constituents because they're telling you you got to watch the price of health care, I get it too. But every one of those people that I've talked to said, if I do this licensing reform stuff and we get some money from the manufacturers, what do you think about that? Oh man, Dave, we're all in. You go get those guys. You get them to the table. And that's what we are doing with this bill. We're just getting them to the table where they help us fix this problem. But this is the hard way to do it. And if you're afraid, I get it. There's a lot of people out in the hallways here that can't stand me right now for talking like this because they're big pharma. And that's okay. I'm here for a little while, and I want to make a difference while I'm here. And I ask for your support tonight. Thank you.
The Majority Leader, Representative Winkler.
Thank you, Mr. Speaker. Thank you, members, for the debate today. This bill is a legacy of love. There is no hate in this bill. Representative Baker, thank you for your remarks tonight and for your honesty and for sharing a little bit of your pain with this body. We need to feel it. The emotion matters. Representative Olson, thank you for your persistence and your dedication and for making this bill as strong a bill as it can possibly be. This bill is the right bill. This bill is the right solution. This bill provides relief, it provides hope, it provides support for the Minnesotans who are damaged by opioids. And this bill includes payment from the people who profited from that damage they knowingly delivered to the people of Minnesota and to the people of this country. The families across our state continue to experience unthinkable tragedies. It is important to remember, members, that opioid deaths in Minnesota are increasing. Despite the attention that we've had on this issue for years and years now, opioid deaths are increasing. The pharmaceutical industry likes to come and tell a good story about their research and the lives they saved and the work that they do that benefits our families and patients, and that is true. But in the case of opioids, members, they are not wrapped in a hero's cape. They are wrapped in a death shroud for many, many, many Minnesotans. This number has been used repeatedly. 422 people died from overdoses in 2017. There were 2,000 emergency room visits in Minnesota in 2017 because of opioid overdoses. Over the past 2 decades, 200,000 people have died, Americans have died, due to prescription overdoses. We all know how the pharmaceutical industry has flooded this building, and the national capital, and any place a legislator goes, there is a pharmaceutical lobbyist trailing not far behind, looking for one more opportunity to tell us what great things that they have done. Pharmaceutical companies like Purdue knew early on that their products were abused, but they still promoted them, and they did so by claiming that people were less prone to addiction with their products. Companies like Purdue misled the public about the dangers of their products, and they aggressively marketed to doctors. One study found that the counties that had the most opioid product marketing from pharmaceutical companies were the counties that subsequently had more opioid prescribing and had more opioid deaths. They marketed death and addiction to people all across the country. Now, you might say that this is not the right place to hold them accountable, that that should happen in a court of law, that lawsuits around the country, including in Minnesota, will do that job for us. Our job is not to hold them accountable. The problem is that they are already pursuing the ultimate solution for their own problem, and that is to declare bankruptcy and avoid any kind of responsibility. The CEO of Purdue is discussing bankruptcy as a way to avoid the overwhelming damage claims that are coming against that company because of the work that they did to hurt so many of us. So we can't do it legislatively. We can't ask them to pay a reasonable amount to cover the cost of responding to this crisis, epidemic, or crime scene, which I think is actually a better word for it. So on the one hand, we can't make them pay, and on the other hand, they can declare bankruptcy in court. The consistent theme is no accountability. They do not want to be responsible. And for many, many years, for decades, they have avoided responsibility. They have lobbied, they have litigated, they have spent money to avoid any kind of responsibility for what they have done. That ends tonight in Minnesota, members. We are passing this bill not to get it to conference committee. We are not passing this bill to continue a discussion. We are passing this bill to hold the people who have harmed Minnesotans responsible and to hold them accountable for the damage that they have done to so many lives. That is what we are doing tonight. I hope that this bill comes back from conference exactly like it is tonight. We will send a very strong bill. We will negotiate with the Senate, and I hope that we can come back with something very, very strong. We are not going to knuckle under and give in to pharmaceutical lobbyists anymore. We are not going to give in to the big money. We are not going to let them avoid responsibility and accountability. We are going to vote green for the Minnesotans who have been hurt, who have been killed, and whose families are suffering. It is a choice. You are either with the people of Minnesota in this fight, or you are with the people who've harmed them. That is what this vote is for. Green for Minnesota, red for pharmaceutical deaths.
The author of the bill, Representative Olson.
Thank you, Mr. Speaker and members. Well, we've had lengthy debate on the bill tonight, and I would like to say this isn't it. This isn't it, and we have much, much more work to do. And you can't say what's good in the bill, but not being willing to say what needs to be done. The reason why I even took this legislation on was I remember in committee hearing Representative Dave Baker present a good bill that was bold and courageous, and it made me respect him a great deal because I knew it wasn't easy. Because it is so hard to do this work. It is so hard. And that's why 2 years ago, that Representative Dave Baker did not come to the House floor for a vote. I would have remembered being able to vote for a bill that spent $20 million in ongoing revenue. I did not vote for that bill because I did not get the opportunity to. So we can't say what's good and how much you want to spend on all of these wonderful programs without actually holding your feet to the fire to do it, because it has not happened. And we are here today to make that happen. So to say you voted for these solutions in the past, you haven't. You haven't. It was one time $16 million in funding for some of these programs. It wasn't $20 million in ongoing revenue that withstands political turnover in the bodies of government that then decide on funding. This bill, it has so much because we know then that we have ongoing dedicated revenue to do the things we say we're for. It's easy to be for something when you don't have to stand on how you're going to do it. So today is the day that if you are for these things, if you are for treatment, prevention, and education, if you are for all of this, is the time to vote yes and show that you are for it. This is it. This is the bold and courageous action that I saw Representative Dave Baker make. And this bill has even gotten better over the last 2 years. But unfortunately, while we waited, as Representative Doubt mentioned, the death toll increases. So it's not our inaction, because we're putting forward a really good bill, and I'd happily have anybody else join me in co-authoring other pieces of legislation I have that spend general fund money. This isn't it, but it is what we need to do. And another thing about this bill that I keep coming back to the quote, and I don't remember who said it, after the final no, there is a yes, and the future of the world depends on it. And I feel like that's where we're in with this opioid crisis. And it's not the people that have profited, it's not the people that have much to gain from this that have come forward with the solutions, it's those that have lost everything. I don't spend my time sitting around with lobbyists that have been, paid to really work to solve this in big ways. I spend my time with a box of Kleenex in my office hearing the story of Minnesotans. That's who writes this legislation. That's who's doing it. Or you know who's solving this problem right now? You know who's solving it? One of the most effective programs I have heard about is coming out of White Earth. White Earth, who has been, as Representative Baker said, 6 times more likely Indigenous person is to die of an overdose. They are the most impacted by this, the least resources to fight this crisis, and they're doing it successfully. They were finding mothers addicted, having babies that were addicted. So first they started interventions with the babies. Then they realized, well, we want to keep our families together. Let's bring the moms in while we're also dealing with that. Then they realized there were dads out in the parking lot in the cars and said, why don't we bring the dads in too and treat this as a holistic family thing to try to keep these families together rather than removing the babies. Then they thought, well, what are some culturally appropriate healing mechanisms that we have here. And they started doing beadwork with the families. And when families were dealing with addiction and they had something to focus on together, something that was culturally healing to them, they would do the beadwork. But then when they would get frustrated from the beads and have to learn how to deal with anger and emotions and mental health, they would have a sweat waiting for them. So they could go take part in another culturally appropriate way to deal with. So they created, even though they are the hardest hit by our crisis, have seen limited resources, if any, from our state to invest in that. They are the ones that developed the solution. So if we're waiting around for the pharmaceutical companies to come to the table with the solution, I'm sorry to say they're not going to do it. They're not going to do it. What we have is the people most impacted. We have the woman driving in from Representative Miller's district, who I can't imagine how much windshield time she has thinking about this. Those are the people that are coming into my office, into the Capitol, who are truly here to work on a solution. And that's what this bill is. This bill is all of the people that have felt so alone, who have come together and said enough is enough. We're not waiting. We're not waiting. And today is the day to be bold and courageous, if that's what it takes. And it isn't even that bold and courageous. It really isn't. This is what we need to do. This is what we need to do to invest in Minnesotans, to hold accountable what needs to be held accountable, and do the right thing. Doing the right thing isn't always easy, and this bill has been even hard for me as a Democrat. There are people every day trying to stop this bill from happening. And we push on. We push on for all the families that have been here how many times telling these stories. We push on because we can do something today. This is a good bill. You can be proud to vote for this as it is. This is a really good bill. And I'm proud to have worked with so many people on this bill to make it what it is today. And I proudly ask for a green vote on this really good bill.
There being no further discussion, the clerk will take the roll. Clerk will close the roll. There being 94 ayes and 34 nays, the bill is passed as amended and the title is agreed to.